So, to introduce our first speaker, Sir Ray Gapus, Dr. Ray Gapus, um, or Mentor Ray, as he wants to be called, is an international author and a multi-awarded digital entrepreneur. He graduated cum laude from the University of Santo Tomas College of Nursing for his bachelor's degree and is a board top-notcher in the Philippine Nurse Licensure Exam, where he obtained a rating of 89.20%. He pursued his master's degree in nursing in the same institution and graduated summa cum laude. He pursued a post-baccalaureate certificate and a master's degree in education in one of the top universities in the United States, and that is the Pennsylvania State University, and finished both courses with GPA of 4.00. He is a recipient of two doctorate degrees, honoris causa from two state universities in the Philippines, the Pangasinan State University and the Ramon Magsaysay State University. Mentor Ray is the first Filipino nurse to author books for international publications for Mosby, Elsevier, and Jones, and Bartlett, USA. So, ladies and gentlemen, let us all welcome Dr. Ray A. Gap.
Thank you very much, Miss April, for the very kind introduction. And sa lahat ng mga nagnanais maging RN, we have less than 10 days to go before you get into the test taker's seat. Anyway, before anything else, I'd like to thank Health Carousel for the invitation to join the experts in the test preparations in the country, headed by the former chair of the Professional Regulatory Board of Nursing, Dr. Glenda Arquiza, and of course, former members of the Board of Nursing. We have Dr. Lucy Simon and Dr. Gloria Arcos. So, pleasant morning, and we have close to 2,000 registrants for today. We sent already handouts, but let me actually tell you, all of you, fellow learners, this is the point in which ang tanong natin sa ating sarili ay, ano ba ang kailangan kong pag-aralan pa? So, hindi na ito yung panahon na magbabasa ka pa ng libro. It's less than 10 days. So, which simply means, hindi rin napapanahon na ngayon ka palang bubuklat ng mga libro mo. This is not the time to do that. Ito rin yung hindi na rin to panahon nung ginagawa nyo na magtatanong ka, huy, anong pinag-aaralan mo? Forward mo naman sa akin sa chat box natin. Forward mo naman sa akin sa email. Tapos ang dami-dami mo nang nakuhang papel. Tapos print mo na lahat. Pagkatapos mong i-print, inorganize mo, nilagay mo sa clearbook, sabay sabing, wow, ang gaganda, ang dami kong aaralin. Tapos, tulog na ako. That's how we are as test takers, okay? We keep on procrastinating. But mind you, fellow learners, itong araw na to ay espesyal dahil malalaman natin ang kahalagahan ng framework. Okay? Mahirap pag wala tayong framework pag mag-aaral. In essence, hindi po pwedeng suntok sa buwan pag nag-aaral ka para sa nurse licensure exam. Kailangan tumbok mo ano ang mga dapat pag-aralan. At my job today is to give an interpretation, my personal interpretation, of the framework, which will be discussed by our experts in a little while. And we have given out handouts on sample NLE-style questions that were based on the specific concepts that are articulated dun sa ating framework. So, in essence, yung student perspective manggagaling sa akin, yung experts' perspectives manggagaling sa ating mga members and former chair of the Board of Nursing. At ang kagandahan nito ngayon, you can ask them directly questions later on how to study based on the framework. Kasi sila mismo yung nag-craft ng framework na yan. And if you may want to go any further, you can ask some of them what is their advice in terms of career pathway na gusto nyong sunodin for your nursing career. So, let's not prolong the agony without further ado. Okay? But before anything else, let me remind you, a copy of the slides for this presentation will be sent to your email after the webinar. Once again, you need to be registered to get a copy of the handouts. Okay? So, let's move on. So, at this point in time, handa na ba kayo? Type yes kung magiging RN ka na at type yes pa rin dahil gusto mo maging RN. Yes and yes lang dapat yan. Ayan, sila Mary, sila Lucia, sila Annalyn, sila, naku, ang daming pangalan, ang bilis-bilis. Okay, yes lahat sila gustong maging RN. Bakit? Sabi nga ni Earl Dalton, the Chief Nursing Officer of Health Carousel, in a forum that they hosted in celebration of the Philippine Nurses Week last month, up to the year 2020, you will be surprised, the world needs 28 million nurses. And this year alone, in the US, in the at makakasama sila, okay? Makakasama sila sa, okay, maha-hire doon sa 4.5 million nurses na kailangan this year at doon sa 28 million nurses na kailangan hanggang year 2030. Type, kasama ako. Go! Come on! Type, kasama ako. Ibig sabihin, maha-hire ka. Parte ng 4.5 million nurses na kailangan ngayong taon lang, 2022, and up to the year 2030, 28 million nurses po, saan kaya nating huhugutin ang mga numerong yan. At any point in time, maraming salamat for joining us for today's session. Okay, so before we get to start, once again, I'd like to remind everyone that this session is brought to you by Health Carousel Philippines. So, good day. Ang tanong, what's new? Ano ba ang bago? Okay? Yan ang tanong natin, no? Ano ba ang bago dito sa ating session ngayon? Isa lang ang bago. Ano yun? Okay? Ito, yung NLE framework. Now, may tanong ako, may idea ba kayo tungkol dito sa framework na to? Type yes kung may idea, type no kung wala. Come on, be honest. Para alam natin, tatanungin yung mga expert. Nako, Dr. Arquiza, Dr. Arcos, Dr. Simon, wala pong nagsasagot ng yes. Anong pag-aaral kaya ang ginawa ng ating mga fellow learners ngayon? Less than 10 days na lang, wala silang idea ng framework. Pailan-ilan lang yung nagta-type ng yes, okay? At yung nag-type ng yes na may idea sila ng framework. Wala po ako alam, promise. Okay, naku. Sabihin mo na sa mga kaibigan mo, mag-log on na sila ngayon dahil ngayon mo lang makikita ang interpretation ng framework based sa mga experts na nag-craft ng framework na yan. Okay, ngayon ang tanong ko, dun sa mga nag-type ng yes, okay, may idea sila ng framework. May tanong ako ha, I want everybody to be honest. Napag-aralan nyo ba yung mga konsepto na kinover ng framework? Yes or no? Napag-aralan nyo ba yung mga konsepto na kinover ng framework? Yes or no? Okay? Sabi nila, may nagsabi yes, napag-aralan. Yung iba no. Naku, paano kaya yun? Magtitake ka ng exam tapos ang sagot mo no. Okay? Yes, more on research daw. O hanggang ganon yung ating alam. Okay. So, paper mamaya, okay, itatanong natin yan sa ating mga experts. Although, it has been articulated that the framework may not necessarily be implemented this year because of the effect of the pandemic. However, since you are already a product of the outcomes-based curriculum, dapat ito yung framework na gagamitin. Okay? Okay. Okay. Let's move on. Okay. Now, a copy of this framework will be provided to each of the participants. It will be emailed to you fellow learners. Now, let me give you an overview. This will be later on discussed further by Dr. Glenda Arquisa and Dr. Gloria Arcos. Okay? So, pag tinignan natin, table of specifications, ano ibig sabihin nito? Dito malalaman, ilang percentage ba ng questions ang easy, ilang percentage ba ang average, at ilang percentage ba ang difficult. Okay? This is based on Bloom's taxonomy, yung 6 levels. So, level 1, remembering, meaning recall, yung mga normal values, ayan. Then understanding, okay, which simply means you should be able to organize data, okay? So 30% yon. So which means kung 100 items ang test items sa isang exam, 30 points basic, recall, and understanding. And then 50% or 50 points would be utilization or application. So you have to know your procedures, you have to know the policies affecting nursing practice in the Philippines, because that would definitely impact on how you will utilize your concepts. And then degree of independence, 20%. So analyzing, evaluating, and creating. The 3 higher level learning, okay, according to Bloom's taxonomy. Now, in a nutshell, ano ibig sabihin nun? 50% ng questions in a 100-item test in the NLE based on this specification would be moderate. So hindi masyadong mahirap, hindi rin naman madali. 30% would be easy, okay? And 20% would be difficult. Okay, so which simply means, okay, 20% lang yung difficult sa exam. So, yung naintindihan ang implication nito, type yehe on our chat box, please. Go! Type yehe. Yan. So, ibig sabihin, 20% lang ang difficult. So, 80% would be easy and average. Okay? 20% would be easy and average. Okay, let's pay particular attention now to the nurse licensure examination subjects. Okay? So, nursing practice 1 would be community health nursing. Okay, care of the individual, family, population control groups, and community. Nursing practice 2 would be care of mother, child, adolescent, and those who are at risk, including acute and chronic, so MCN. NP3 would be care of clients with problems of oxygenation, fluid and electrolytes, infectious, inflammatory, and immunologic response, including cellular aberration, which means yung cancer or oncology nasa NP3. And then NP4, problems in nutrition, gastrointestinal, metabolism, endocrine, perception, and coordination. So which simply means gastrointestinal, yung mga diet, yan, nasa NP4. And then NP5, maladaptive patterns of behavior, that's psych, okay? Acutely ill, and multi-organ problems, and high acuity and emergency situations. So ang emergency nursing, okay, including establishing priorities and triaging will be on NP5, okay? In a nutshell. Mamaya yan, okay, we'll have more of this from our panel of experts. And then, dun sa Philippine Professional Nursing Practice Standard sa baba ng ating illustration, I'd like to highlight one thing. Kasama sa bagong framework ang transcultural nursing care. So this is something that sets it apart from the previous framework. So ako ang mag-aaral ngayon, so pag-aaralan ko, okay, mga health beliefs and practices, okay, ng iba't ibang lahi, okay, because the nurse has to learn how to deal with issues in a multicultural setting, okay? At saka pag-aaralan ko yung theory ni Madeline Leininger, okay? So, at this point, meron na ba kayong idea ano ang tatahakin nating landas? Type yes or no on our chat box, go! Meron na ba kayong idea? Okay, mas malalim pa yan as we engage in our next set of sessions. Okay? Mamaya, meron na daw. Ngayon, ang tanong, meron lang akong tanong. Dito sa nakalagay sa framework, ilang percent ang napag-aralan mo? From 70 to 100%. Ilang percent ang napag-aralan mo na dyan? Come on, type your response. Is it 70%, 80%, 90%, 100%? Oh, 80%, very good. 70%, very good. Okay? 70%, okay. 70%, okay. Walang naglagay ng 100%. Ano ba? Libre lang ang pangarap, libre lang ang confidence. Kailangan confident ka. Pagpasok mo sa test room, dapat ang sinasabi mo sa sarili mo, alam ko lahat yan. Ganon. Now, remember the law of attraction. Whatever comes out of your mind, your heart, and your mouth comes echoing back to you. So kung ikaw mismo hindi ka naniniwala na napag-aralan mo yun ng 100%, sino pang maniniwala sa'yo? Kaya dapat ang nakita kong sagot dyan, 100%. O yan, ulitin natin. Ulitin natin ang tanong. Okay? Ilang percent na dyan na napag-aralan mo? Go! Ayan, yan dapat ang sagot. 100%. Oh, you have to have that confidence. Okay? Now, meron nagpapaka-humble, 99%. Oy, 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 false humility yan. Hindi ako naniniwala dyan. Kung ikaw, naglalagay-lagay ka ng 99%, nako, bahala ka. Kung lahat naka 100% at ikaw lang ang naka 99, o magsisisi ka rin. Anyway, yung iba naman 101%. O sumobra namang unconfidence niyan. Okay? Ngayon, yung wala pa rin confidence, anong gagawin? Pumunta ka sa Quiapo, maglagay ka ng lamesa mo, kumuha ka ng payong at tarot card, doon ka nababagay, manghula ka na lang. Yan dapat ang gawin mo. Kung wala kang confidence, maglagay ka ng pwesto sa Quiapo. Okay, so let's move on. Class, okay, I just speak like this, ha? Don't get offended. Okay? Sabi sa yan ni Sir, oo naman. Dapat positibo lang ang energy natin. Let's move on. Here we go. Now, handa na ba kayo na makakita ng examples ng application ng framework into NLE style type of questions? Type yes or no. Go. Type yes or no. May tanong ako. Sino ang naka-receive ng kopya na nito through email? Type yes or no. Sino ang naka-receive ng kopya na nito through email? Type yes or no. Type yes or no. Sino ang naka-receive? Ang dami naka-receive. Okay. Ngayon, yung hindi naka-receive, ibig sabihin, hindi ka nag-register ahead of time. Okay? Pasensya na, walang manghuhula sa Health Carousel. Hindi kami manghuhula para malaman na hindi pala kayo naka-receive. Kung hindi ka naman nag-register, hindi ka nagbigay ng email mo, paano ka makaka-receive? Okay? Yung isa naman, naka-receive, hindi naman inopen. Ano namang klaseng mentalidad yan? Ganito. Kaya namin yan binigay ahead of time so that you will need to answer it ahead of time. O ngayon, yung mga hindi nag-open, ano nangyari sa'yo? Okay? Bakit muna naman ipinospone ang story of success mo? You don't do that, colleagues, fellow learners. You have to take the first shot at learning the first time you get the opportunity to do so. That is not a secret of a successful test taker. Na-receive mo na yung material mo, hindi mo pinansin. Anong balak mong gawin yan? Yan yung kahit i-age mo, hindi tataas ang value niyan, hindi yan magiging antique. Hindi magiging antique. Yang hindi mo din-download na test paper mo. Kailan mo isasagutan yan? Ngayon, hindi kita bibigyan ng oras na sagutan yan. That's a waste of time. You should have done that on your end before engaging in today's class. Okay? And yung mga nagsagot naman kahapon, okay, very, very good. Okay, now let's move on and let's find out whether tama ang sagot nyo. Here we go. Ready na ba kayo? Type yes or no kung ready na kayo at handa na kayong malaman ang tamang sagot. Okay, here we go. Okay, so if you would notice, one of the concepts that was articulated in the framework is care of clients. Doon sa old framework, safe quality care yan. Okay. You see the word clients. Pag sinabi kasing patient, it implies someone who is unwell or sick. Pag sinabing clients, it includes those who are healthy and sick. Okay? So pag sinabing care of clients, kailangan pag-aralan mo ang normal na pasyente at ang abnormal na pasyente. In essence, dapat holistic ang perspective mo. O ngayon, ano ba ang kailangan nating pag-aralan based on this? Okay, let me give you a functional concept. Ano ba ang functional concept? A functional concept, okay, is a word, a sentence, a phrase, or even a paragraph that gives your mind a sense of direction on how to deconstruct a question, which simply means kailangan mo ng functional concept para ka mas kasagot ng Tama. So let's begin. Analyze the data gathered in order to provide appropriate nursing care. When you say analyze, sabi ng isang estudyante ko, Sir, bakit ba may analyze? Wala po bang oralize? Walang oralize, analyze lang. Okay, so in essence, the main problem of test takers is that they engage in over-analysis. Remember, over-analysis leads to paralysis. Eventually, you don't know what to do next. Nakatanga ka na lang sa harap ng question. Okay? So, in essence, kailangan pag nag-analyze ka, marunong kang maghimay ng data. Let's have an example. And this is question number 1 in your material. A patient is admitted to the hospital with urine-specific gravity of 1.030. That's abnormal. The normal specific gravity could be 1.010 to 1.025. Now, when the specific gravity does not fluctuate, chances are the client could be in renal failure. If the specific gravity is less than 1.005, chances are the patient could be suffering from diabetes insipidus. Okay? Now, if the specific gravity of the urine is just too high, meaning it's concentrated, it could be that the patient's having diabetes mellitus or syndrome of inappropriate antidiuretic hormone secretion, or SIADH. So you have to bring that to your mind to be able to analyze the data. Then a temperature of 102 or 38.9 degrees centigrade, that's already indicative of fever and flush, dry skin. So meaning there's heat in the body. So what should come into mind? It could be that the patient is having dehydration or fluid volume deficit. Now, the question is, pareho ba ang dehydration at blood volume deficit? Hindi. So when you say dehydration, that's due to a decrease in the total fluid volume in the body. Pero pag sinabi mong blood volume deficit, it's just the contraction of the plasma or the blood volume. So the more appropriate term, therefore, to encompass both blood and other body fluids would be fluid volume deficit. Now, let's get through the options. A, potential for impaired skin integrity. It could be something that you can relate with a dry skin, but is it the main problem? Remember, this is just a risk diagnosis because you have the term potential. B, fluid volume deficit related to fever. C, potential for fluid volume deficit caused by fever. And D, altered cardiopulmonary tissue perfusion related to fluid excess. Now, zero in on letters B and C. Almost similar. Tatandaan mo in the board exam, the correct answer could be one of two almost similar but opposite options. Okay? Why would we say that this is an almost similar options? Look, pareho silang may fluid volume deficit. Pareho silang may fever. The difference is letter C says it's potential. But if you're going to analyze the data that you are given in the question stem, you would know that the patient now is manifesting actual symptoms. So this is not related to a risk nursing diagnosis. This is related to an actual nursing concern. Therefore, the correct answer is letter B. Fluid volume deficit related to fever. Sino nakakuha ng tamang sagot? Type yes. Okay. Magandang buena mano yan. Now, take note. Care of clients, okay, would usually be one of the main concepts that you need to focus on when you are studying for the NLE. So far, class, are you learning? Tell me. Opo o hindi? Okay? Opo. Okay. So that's just number 1. Gandang buena mano. Siyempre, kailan sa buena mano, tama ka agad. Okay? Next. Aminin natin o hindi, communication is threaded through from test 1, test 2, test 3, test 4, test 5. Okay, ngayon, ang tanong, ano sir ang pag-aaralan ko about communication? Remember, the framework is integrated. Sabi niya, care of clients, meaning the healthy and the unwell. Now, most patients would have problems in communication, will have the condition known as aphasia. So pag sinabi nating aphasia, it could be associated with the frontal or temporal lobe disturbance. If the Broca's motor speech area, which is located in the left frontal lobe, would be affected, then the patient will have expressive aphasia. Now, if the Wernicke's language area responsible for comprehension located in the temporal lobe will be the one that is affected, then the patient will have receptive aphasia. So yung expressive aphasia, hindi ka makapagsalita. hindi makaintindi ng language, whether spoken or written. So pareho niya hindi maintindihan yon. Yung merong receptive aphasia, hindi makaintindi. Parang tayo, minsan di tayo nakakaintindi, di ba? So pag sinabing receptive or Wernicke's aphasia, inability to comprehend. Expressive or Broca's motor aphasia, inability to say things. Now, whether you have receptive or expressive aphasia, visual aids are very important, which simply means kailangan gumamit ng communication board or picture board. So ano yung itsura ng picture board? It could be a simple paper with a drawing. Kasi yung may expressive aphasia, hindi niya alam ano yung gusto niyang sabihin. So kung kailangan niya ng tubig, kailangan meron siyang picture board na may drawing na baso at may tubig. Yun lang papakita niya sa nurse, ibig sabihin kailangan niya yon. Okay? So in terms of studying communication, huwag kayong mag-stick dun sa elements of communication, principles of communication, huwag lang yun ang pag-aralan. You have to study the concept in relation to both the sick and the well patients. So you always have to know which difficulty is the patient having? Is the patient having expressive aphasia? Is the patient having receptive aphasia? Or is the patient having dysarthria? Ano yung dysarthria? Difficulty in articulating oneself. Ano ba yung articulation? Articulate. Maarte na, makulit pa. Hindi. When you say articulation, using the muscles, okay, that are involved in communication, which simply means you will also need to assess your cranial nerves. Now, what cranial nerves are affected in a patient with dysarthria? Cranial nerves 5, 7, 9, 10, and 12. Yan, mga yan, affected. So, malalim pala, sir, ang konsepto ng communication. Oo, hindi yan kababawan. So, if I were you, I should begin studying, okay, specific to the disorders in communication and your priority intervention. Okay, let's begin with the functional concept. Use available visual aids when interacting with patients. Ano sabi natin kanina? Pag may expressive aphasia or receptive aphasia, picture board ang gagamitin. Okay. Pag may expressive aphasia, kailangan natin na i-assist yung pasyente to speak. Okay? So maybe we can ask them close-ended questions that would just require them to nod their head or shake their head to say yes or no. So, you don't require them to explain pag may expressive aphasia. They are unable to do that. Pag receptive aphasia naman, hindi makaintindi, so talk slowly. Huwag yung katulad ko na daldal ng daldal. Okay? Talk slowly. Pace yourself properly. Okay. Here's question number 2. We use the functional concept to analyze question number 2. For the client who is experiencing expressive aphasia, so frontal lobe is affected, the Broca's motor speech area is affected, which nursing intervention is most helpful in promoting communication? Give me an answer, colleagues. Fellow learners, give me an answer. Give me an answer. You're talking of expressive aphasia. What did we say? Communication board. Excellent. The answer is letter B. Yung speaking slowly, para yun sa receptive aphasia. You have to differentiate between expressive aphasia and receptive aphasia. Pag expressive aphasia, use a picture board. Pag receptive aphasia, speak slowly in short sentences. So far, so good. Natututo ba? Tell me, colleagues. Yes or no? Natututo ba? Yes or no? Okay. Mapapakinabangan ba itong ginagawa natin? May katuturan ba ito sa iyong preparasyon? Oo naman. Siyempre naman. Okay? So let's move on. The third would be continual quality improvement. Ito. Nakita mo kanina doon sa konsepto, quality improvement. I want you to be honest. Okay? Quality improvement. Alam mo ba anong pag-aaralan mo dyan? Tell me. Yes or no? Alam mo ba anong pag-aaralan mo dyan? Be honest. Huwag nagmamamarunong, huwag mamaru. Alam mo ba? Yes or no? Okay. So sabi ng iba, no. May isa nagsabing yes. Okay. Aral na aral siguro yung nagsagot ng yes. Okay? So, let's pay particular attention now on this concept, okay? Always remember the functional concept. Always identify opportunities for improvement of care, improvement of patient's condition, improvement of processes and procedures. So, always identify opportunities. That's the concept, okay? How do we use that? Here's an example. A nurse was doing case finding and health education in a barangay in a rural community of Tokok. Meron talagang ganyang baryo doon sa amin, Tokok, Pangasinan. O yung mga taga Pangasinan dito, patunayan nyo sa akin yan, yes or no? Patunayan nyo sa akin yan, yes or no? May Tokok, meron ang Tokok elementary school eh. Her target is to identify undocumented cases of leprosy or Hansen's disease. During a home visit, a woman who saw her in uniform remarks, "You're not a nursing student, are you? I have many chores today to do today, please," and ignores the nurse. The nurse's immediate course of action would be to, now, always remember that when you're trying to identify the potential reason for the misbehavior of would-be clients, focus on root cause analysis. So ano ba ibig sabihin ng root cause analysis? You're trying to discover the reasons for a specific behavior. And when you say root cause analysis, think about the nursing process. You always begin with assessment. So assess why the behavior of the patient is that. Give me an answer based on our discussion. Come on. Correct. The answer is D. Assess the feelings and behavior manifested by the woman and get to the causes of such behavior. So far, learning? Yes. Okay. Natututo? Yes. Okay, great. Now, take note, class. Na-notice nyo sa question na yan, ang haba ng situation. Minsan nakakapagod magbasa, pero pagtiyagaan nyo. At kahit meron ka ng alam, basahin mo pa rin bawat isa doon sa options. Number 4, concept number 4, ethical principles. Ayan. Ito naman, threaded through din yan. Alam nyo, kahit mag-NCLEX kayo, may questions about ethics, di ba? Okay, so, functional concept. When deception is committed when providing interventions, it is a violation of respect for the patient's right to receive treatment. Okay. When is deception occurring? Whenever there is an opportunity in which a healthcare provider could be using a placebo. What is a placebo? So it's a substance that doesn't have any pharmacological effect at all. Like for example, ayaw mo ma-overdose yung pasyente mo ng narcotics. So instead of giving narcotics to relieve the patient's pain, nagbigay ka ng NSS. Okay, now, that is an ethical violation of respect for the patient's right to receive treatment, or the respect for the patient's right for autonomy to choose the kind of treatment they want for themselves, which simply means, pagka gumamit ng placebo, na-violate mo ang ethical principle of respect. Okay, now, using that functional concept, okay, sagutan natin ang question na ito. A cancer patient with very severe and intense pain demands that the pain reliever be administered even before due time. To appease the patient, the nurse injects NSS as a placebo. Which principle will the nurse transgress with this intervention? Ayan, hindi niya naintindihan yung transgress. Na-violate, okay? So, is it respect, veracity, justice, or fidelity? Okay? When you say fidelity, you keep your promises, your word of honor. When you return after 15 minutes, as you told the patient that you're just going to prepare something and you returned after 10 minutes, that's fidelity. Justice means, okay, fairness. You are equally dividing the resources properly. Veracity means truth-telling, honesty. So the answer to this question is correct, letter A. So far, so good. So the answer is respect. Okay, next. The fifth, legal responsibility. Now, always remember, not all made legal by law is morally correct. Kahit na gawing legal ang abortion, hindi pa rin yun morally correct. Therefore, as a professional, you both have to consider ethical and legal perspectives of a situation. Okay? So here is a functional concept. Always check the informed consent. Now, okay, there are several issues that we need to focus on related to informed consent. Sometimes you would see literatures dealing with informed consent given by people who are less than 18. Okay? Specifically, these are called emancipated minors, meaning minors who are independent, no longer under the house where their parents live, they are self-supporting, or they are in the military. But take note, in the Philippines, a lawyer friend told me, we don't have an emancipation law. So which means, hindi applicable yun sa atin. Yes. But, kailangan ba natin pag-aralan? Correct. Because, when you talk of nursing licensure exams, these are theoretical concepts, which simply means these are based on literatures that could impact your practice whether you're doing it here in the Philippines or abroad. So ang tanong, kailan ko bang pag-aralan yung set? Oo naman. Okay? Now, hindi mo lang dapat mini-memorize na what's the purpose of informed consent, what are the requirements of informed consent. Masyadong basic yon. Think about how the concept of informed consent could arise from situations that affect your practice as a beginning nurse. Okay, so ano yon? Let's have an example through this question. A 12-year-old Filipino-American child wants to have her ears pierced for a new pair of earrings she got from an aunt who recently arrived from the United States. So, dual citizenship ito. Okay? O katulad ng aking mga kasama ngayon, mga dual citizens. Okay? Ako, hindi pa ako dual citizen. Okay? So, ano ibig sabihin ng dual citizens? First, they are Filipino citizens. And second, and bakit sila naging dual? They are now senior citizens. Ma'am, no offense meant po. Malapit na rin po ako maging senior. So, pag naging dual citizen na ang mga tao, ibig sabihin, aray ko, tumatanda na tayo. Okay. So, ngayon, tanong, the aunt instructs, ano daw ibig sabihin ng aunt? Yan ba yung langgam? Hindi. Tita, the aunt instructs the child's mother to accompany her child for ear piercing. And this is done because, o sige nga, hindi ko muna i-discuss yan. Hindi ko muna i-discuss. Bigyan niyo ako ng sagot. Is it A, B, C, or D? Is it A, B, C, or D? Wow, may mga nag-aral. Yung iba, letter D. Ear piercing requires the consent of both the mother and the child. A, 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 A. Sabi natin, di ba? Okay? Hindi naman emancipated yung 12-year-old nakatira pa rin sa magulang niya yan. Hindi rin siya married, hindi rin siya buntis, hindi rin siya nagkaanak. So yun, ang definition ng emancipated minor ay below 18, na nabuntis, nagkaanak, hindi na nakatira sa magulang, nasa military at declared emancipated by law. Hindi naman yun Okay? So mali ang letter D. Now, question. Ano ba yung batas ng Amerika? In some states, like in California, you cannot just pierce any body part, including the genitals, of a person below 18 without parental consent and guidance. So, ibig sabihin, dapat isa sa parents, sasamahan yung bata. Okay? In some other states, ang rule nila, pag below 16, meaning, wala pang 16 years old, okay? Kailangan samahan ng magulang kahit magpabutas lang ng tenga. Yung independent, na hindi na kailangan ng presence sa magulang para magpabutas ng tenga, ito na, 16 years old yon. O ano pa ba, bukod sa tenga ang pinapabutas? O yung mga nag-asawa, di ba? Ano pa ba ang pinapabutasan nila? Nagpabutas daw ng, sorry for the term, this very scientific, hymen. Di ba? Pag nabutas ba yung hymen, pwede bang gumawa ng, dokumento dyan? Ano yun, sir? Affidavit of loss of virginity, may ganun ba? Wala namang affidavit of loss of virginity, di ba? Pumunta ka sa rekto, meron ka bang dokumentong pwede ka magpagawa ng ganon? Wala. Okay, so back to our concept. I'm just making the discussion a little lighter so that you're gonna enjoy it kasi malalim to Okay? So the answer is letter A. Okay, now, colleagues. Count the number of correct answers you get so far. Are you getting at least 3 out of 5? Come on. Ilan ang sagot mo out of 5? Ilan ang tumama? Wow, 5 out of 5, 4 out of 5. Oy, Ma'am Vicky, the president of Health Carousel, you have potential top-notchers again dito. Last year, isa sa mga nag-number 1, nag-attend ng Health Carousel. Masterclass. Ayan, nakakakuha sila ng 5 out of 5. Congratulations, keep it up. And don't forget, wag mo nang mag-execute ng affidavit of loss of virginity hanggang hindi nagiging RN. Kailangan muna RN bago mag-affidavit. Okay? Promise? Promise me? Okay, promise. Okay? Kailangan muna RN. Ha? Wala munang affidavit of loss. Okay. RN muna bago mag-affidavit of loss. Let's move on. Accountability and responsibility. Now, here we go. Colleagues, a lot of you, not many of you, are studying the concept of delegation and knows how to differentiate it with the concept of assignment. So let's pay particular attention to 2 important words that we need to define. First, when you say responsibility, it simply means the performance of duties or tasks. When you say accountability, it simply means answerability to the outcomes, whether that's positive or negative, of your performance of a task. So, gawin nating simple. Pag sinabi mong responsibility, yun yung trabaho mo. Pag sinabi mong accountability, yun yung pananagutan mo kung ano man nangyari dahil sa trabaho mo. Now, how do we apply these concepts in terms of delegation and assignment? When you say delegation, you transfer the responsibility, but the accountability remains with the RN. So pag sinabing delegation, inutusan mo yung unlicensed assisted personnel or nursing assistant, pero pag may nangyari sa pasyente, habang pinaliguan niya, nadulas na untog ang ulo, sino ang mananagot? Ikaw. Kasi the RN is still accountable under the principle of delegation. But when you speak of assignment, it's the transfer of both accountability and responsibility. Ibig sabihin, pag sinabi mo doon sa isang staff nurse, o ikaw na magpaligo ng pasyente ha, assigned yan sa'yo. That word, assigned yan sa'yo, meaning you transfer the responsibility and the accountability. Pag nadulas yung pasyente na untog, siya na mananagot. Kasi you transferred both accountability and responsibility. That's assignment. In delegation, you just transfer the responsibility and the accountability remains with the RN. Awatable ba, mga fellow Ilocano? Naintindihan ba, colleagues? Yes or no? Naintindihan, naawatan? One apo ay nagadaduti Ilocano dito. Yes, one apo. Okay, now, here's a functional concept. Responsibility refers to the performance of one's duties, while accountability refers to the taking of ownership over the results of the performance of your tasks. Okay, let's apply the concept. Which client should be assigned to the nursing assistant? Give me an answer. Tignan ko muna kung ano sagot nyo. May sumagot A. May sumagot D. May sumagot C. May sumagot D. Agkakanat ang sagot nyo. Hindi kayo magkakasama. Bakit? Umamin kayo. Hindi nyo alam. This is telling me this is your weakness. You don't know about delegation, accountability, and responsibility. Wrong, wrong, wrong. Majority of you got it wrong. Listen, class. Listen. Listen. Unstable patients should not be delegated. Sino ba yung unstable? Oh, di ba pag may cervical spinal cord injury ka, you will be on a ventilator. So hindi ka pwedeng i-assign sa nursing assistant. You cannot be delegated. When a patient has meningitis, that's highly infectious. It should be the RN doing that. Okay, you are left with 2. Okay. Ang sinagot na naman ng iba letter D daw, airway, airway. Nga. Bakit? Thoracotomy, ibig sabihin there's a potential chance that the airway will be compromised or the breathing or the expansion of the thorax could be compromised. Now, always remember this. Stable patients can be delegated. Who are the stable patients? Chronically ill patients are considered stable. Patients in traction are considered stable. So, patients in traction, ang focus lang yan, provision of activities of daily living. Paliguan mo, pakainin mo, punasan mo ng maayos, palitan mo ang linen. So, sino ang i-assign mo sa nursing assistant? The answer is letter C. Honestly, you have to tell me, ngayon mo lang yan natutunan, yes or no? Tell me, ngayon mo lang yan natutunan, yes. And you have to be ready for these types of questions. Okay? So this is very, very important. O, merong nagyayabang na hindi daw ngayon niya lang yan natutunan. Hari na what makakuha ka ng rating na 95. Okay? Remember, humility is always the first step toward success. Kung masyadong mataas ang tingin mo sa sarili mo, o magsimba ka na lang sa Quiapo, siguro yun na lang ang kulang mo, top-notcher ka na. Okay? So let's move on. Okay, concept number 6. Management of resources and the environment. Okay, so here's a functional concept. When you're creating an action plan, remember Garce, the action plan should be based on goals, activities, resources, support, and sustenance. Then, finally, evaluation. You have to determine the impact of your action plan in relation to the population groups where you have implemented it. So, here's a sample question. Concept number 7, inspired by the dancing persons deprived of liberty in Cebu, the nurse suggests to the barangay chairman that the out-of-school teenagers may be encouraged to stay out of trouble by organizing activities that will occupy their time, use up their energy, and unify them. To realize such goals, ayan, yung step number 1, goal setting, nasa question na. The nurses and the community's action should proceed in which of the following order? So ano ang pangalawa? After you create the goal, ano ang pangalawa? You have to design the program. Ano ang pangatlo? You will identify your resources. And then ano ang pang-apat? Support system and sustenance. At ano yung pang-lima? Evaluation. So give me the answer to this question. Excellent. That's letter B. Okay? 2, 1, 3, and 4. Okay. Next, concept number 8. Ayan. Ethico-moral responsibility. Hindi nawawala ang ethico-moral responsibility. Bakit? Okay. Highlight yan ng pagiging professional. You always have to do what is right, regardless of your personal opinion. Okay? Kailangan doon ka sa tama. Okay? Whatever it takes, kailangan gawin mo ang tama. Okay? Depende yan sa how you were raised by your parents. Okay? And that's very reflective of your ethico-moral standing. Okay? The Professional Regulatory Board of Nursing Resolution number 220, okay, series of 2004, the Code of Ethics for RNs includes, ito yung 5 part. The preamble, RNs and the people, Article 3, RNs and the practice, Article 4, RNs and the co-workers, and Article 5, RNs, society, and environment. Now, what is the basis for the Code of Ethics? The Code of Good Governance for Professions in the Philippines. Okay, so let's pay particular attention now using this concept to answer a question. The Code of Ethics for Nurses has articles relating to the relationship of nurses on which of the following blank. Select all that apply. Give me an answer. Kasama ba yung people? Oo. RNs and people, Article 2 yan. Kasama ba yung practice? Yes. RNs and practice, Article 3 yan. Kasama ba ang co-workers? Yes. RNs and co-workers, Article 4. Kasama ba ang society and environment? Yes. RNs and society and environment, Article 5. Therefore, the correct answer is letter C. Okay. So, colleagues, so far, so good? Are you learning? Okay, great. Let's move on. Records management. O, ayan. Yan ang paborito mong gawin, di ba? Mag-chart. Okay. Now, let's pay particular attention to this concept. Here's a functional concept. Nursing documentation should provide appropriate and pertinent information. The keyword, appropriate and pertinent information, which can be utilized to determine the severity of illness, intensity of services needed, and the quality of care, which simply means you have to document the appropriate information. Okay. Let's use this functional concept to answer a question. A 3-year-old child has ingested kerosene contained in a bottle of soda. When the mother saw the child, she immediately brought him to the nearest hospital. So this is a case of poisoning. Now, what is your priority intervention if you have a case of poisoning? Theoretically, the answer is call the Poison Control Center. Pero dito sa Pilipinas, active ba ang ating Poison Control Center? O naputulan na rin ng linya. Kaya pag denial mo yung kanilang number is ang sasabihin sa'yo, the number you dial is not yet a telephone. The number you dial is not yet a So, wala mong Poison Control Center. But again, ang sinasabi ko, licensure exams are supposed to be ivory tower nursing. Huwag kang namimiloso po na hindi naman applicable. Ang mini-measure dito, your knowledge of ideal nursing practice. So, kahit the telephone number you dial is not yet a telephone, yung pa rin ang isagot mo. Call the Poison Control Center. Pag ang tanong ay, what is the priority? However, that's not the question. Okay? Let's read through it. When the mother saw the child, she immediately brought him to the nearest hospital. The nurse should document which of the following assessment findings. First, when there is poisoning, you make sure that you bring the bottle of the poison to the hospital for proper identification. But take note, pag dinala mo yung bote ng poison, dapat kasama yung bata. Hindi dinala mo sa ospital yung bote ng poison, naiwan yung bata sa bahay. In that case, mamamatay yung bata sa sarili niya. So dapat dalhin mo yung bata at kasama yung bote ng poison. Ano ba? Okay, dapat malinaw tayo. So bakit kailangan natin dalhin ang bote ng poison? Para ma-identify yung poison, para malaman gaano kadami ng poison, at para ma-relate yung signs and symptoms. Now, kailangan ba sir yung timbang ng pasyente? Oo, kailangan ng age at timbang para ma-compute how much antidote will be given. Pero, meron bang relationship kung nabakunahan yung bata o hindi? O, halimbawa, yung bata nabakunahan ng bading-bak siya. May bakuna palang gano'n. Bading-bak siya, oo, nabakunahan. Okay. So, hindi relevant ang bakuna doon sa poisoning. Therefore, the correct answers are options 1, 2, and 3. So, the answer is letter D, 1, 2, and 3. Yan po ang tamang sagot. Class, at this point, are you learning? Yes or no? Okay, you're learning. Are you having fun? Okay, but make sure your fun should not supersede the learning. Dapat mas importante pa rin yung learning. Kaysa sa tawa ka ng tawa dyan, wala ka naman na isulat kahit isa dyan sa papel mo. Okay, so let's move on to concept number 10. Personal and professional development. Okay, pag sinabi mong personal and professional development, how do you develop yourself as a professional? Okay, ang highlight dito ay yung iyong etiquette as a person and as a professional. Saan nakikita yon? Sa social media. So wag kang paskil ng paskil dyan sa social media nang hindi ka galang-galang. Kasi dapat nakikita dyan, hindi lang yung personal na aspekto ng pagkatao mo, kundi pati yung professional na aspekto ng pagkatao mo. Okay, now, let's have a sample functional concept. An advanced practice nurse is one who has met advanced education and clinical practice requirement and often provides services in community-based setting. Ngayon, ang tanong nila dito ay, ano ba ang kaibahan ng advanced practice nurse at ng clinical nurse specialist? Ang clinical nurse specialist is a type of advanced practice nurse. But if we would want to be more specific about it, pareho yan na master's prepared or doctorate prepared. Ang difference, yung advanced practice nurse is at the forefront of providing nursing care. So frontliner yan. Okay? Ibig sabihin, ang focus niyan, diagnosis and treatment of conditions. Okay? Yung clinical nurse specialist, usually they work in the background. What do they study? Processes. How to improve the processes, the procedures. So the focus of the clinical nurse specialist, therefore, is to study the process in order to help prevent the uptick of cases para hindi lumala at dumami ang mga kaso. Now, whether you have advanced practice nurse or clinical nurse specialist is very important for you to study, fellow learners, yung theory ni Benner, from novice to expert. Ngayon, ang tanong, sino ba yung novice? Okay? Tatandaan mo, yung progression, yung 5 levels, NACPE, novice, advanced beginner, competent, proficient, and expert. NACPE. Okay. What is the basis for moving upwards? Years of experience. Pag less than 1 year ka, nandun ka sa novice. Pag 1 to 2 years ka na, nandoon ka na sa advanced beginner, where you always observe the principles. Nakafocus ka pa doon sa mga lessons mo. You allow the principles that you gain from your experience to guide you. Yun yung advanced beginner. Ngayon, pag ikaw ay 2 to 3 years na on the job, ang tawag na sa'yo, competent. Okay? Now, pag competent ka, you always base your actions on goals. Okay? And the plans of the unit. So, goal-oriented ka na. You have a daily goal to achieve. Yan. Nandiyan ka na sa stage na tinatawag na competent. 2 to 3 years bago mo makuha yan. Now, after competent, then you now become proficient. Okay? Kailan na-achieve ang proficiency? After 3 to 5 years on the job. So, a proficient nurse is one who is intuitive. Ano ibig sabihin ng intuitive? Flexible ka na at efficient. Hindi ka na rigid sa mga rules. Yung rigidity sa rules, nasa advanced beginner yan. You always base your action on principles. Okay. Now, after 5 years, then you now become an expert. Now, my question is, expected ba lagi after 5 years, expert ka na? Meron tinatawag na experienced non-expert. They have the years of experience, but they did not develop the expertise. Bakit hindi na-develop ang expertise? Ang daming pinakaialaman. Naging jack of all trades, master of none. You only have to focus on the area that you want to have professional growth in. So it simply means, mamili ka anong gusto mo. Ano ka ba? OR nurse ka ba? ICU nurse ka ba? Nurse education ba ang gusto mong area? Then pag sunugan mo ng kilay, yung lahat ng kailangan para ikaw ay maging eksperto doon. Hindi ka pwedeng expert sa lahat ng bagay. Walang ganon. Okay? So, pagka ikaw ay expert na, hindi ka na nagbabase sa libro. You base it on gut feel. And that is usually manifested in your leadership skills. So, as an expert, you can now supervise, you can now manage change, you can now train your personnel, and you can inspire and influence them. Ayan, eksperto ka na. Isa ka ng leader. But make sure na kung ikaw ay maging eksperto, you always have to be open to the ideas and suggestions of others. No man is an island. May matututunan tayo kahit doon sa mga sinasabi natin na mas mababang uri. Sabi nga ni Senator Miriam Defensor, di ba? Species of lower life forms. Okay? May matututunan pa rin tayo sa mga ganong klaseng tao. Okay? So let's use this functional concept to answer this question. Which of the following best describes an advanced practice nurse? Okay? Okay. Advanced practice nurse. Okay, give me an answer to question number 10 based on our discussion. Based on our discussion. Nako, nagkakamali sila. Nagkakamali sila. What did I tell you, class? Okay. What did I tell you? Sabi natin, ang advanced practice nurse ay frontliner. Okay? Which means they are engaged doon sa grassroots. So, nasaan yan? Look at A, B, and C. Nasa ospital lahat yan eh. So the best answer is letter D, a certified registered nurse who provides primary care. That's the key word. In a community health setting. Okay? So tatandaan mo yung primary care and community setting. That defines an advanced practice nurse. Ala A. Okay, now, out of 10, type, how many are you getting correctly? Come on, how many? Out of 10. Somebody says 9 out of 10, 8 out of 10. Wow, ang dami nakaka-9. Dami nakaka-7. Okay, mukhang handang-handa na nga sila. At yung mga hindi nagta-type, okay, ipagdadasal ko po kayo. Samahan ko kayo sa Quiapo. O somebody is getting 10. Sabi na, Ma'am Vicky, you have a potential number 1 again in this class. Okay? And concept number 11, management. Ayan. Okay, so here's a functional concept. The Donebedian quality care model in terms of management includes your SPO, structure standards. This involves organizational and physical characteristics or systems. Examples would be technology, facilities, ratio or personnel, or programs. Ayan. Ang programs, structure standards yan. Process standards, care delivery. Pag nakita mo na yung phrase na nursing care, actual care, process standards na yan. Diagnosis, treatment, or in essence, what is done to patients. And then, outcome standards refer to the impact of healthcare services or on interventions, meaning the results. Nag-increase ba ang death or mortality rates or surgical complications? Those are all outcome standards. Now, let's use this concept to answer a question. Which of the following are examples of structure standards that are critical to the success of different public health programs? Sige nga, bago ko sagutin yan, give me an answer muna. Give me an answer. Is it A, B, C, or D? Type your response bago ko sagutin. A, B, C, or D? O, tignan mo. Meron nang tinamad mag-isip. All of the above daw. What did I tell you kanina? Pag nakita mo yung nursing care, actual nursing care, process standard yon. Hindi yon structure. Ano ba tinatanong ng question? Structure standards. So pag structure in standards, ano sabi natin? Systems, programs, facilities, number of personnel. So, system ba yung cold chain? Yes. Yung essential drugs, is that a program? Yes. Ayun na, nandun na yung sagot. Public health programs. Okay? Okay. So, yung TB control program, yes, that is a public health program. Yung nursing care of patients, is that a program? No, that's actual nursing care. So, that's process standard. So, ang sagot, C, all except 3. Mag-isip, ha? Mag-isip. Kasi pag hindi nag-isip, okay, mas maganda, ibenta mo na lang ang utak mo, baka maging bilyonaryo ka because you have 2 to 3 billions of neurons in your brain. Kasi pag yung utak mo, lagi mong ginagamit sa pag-iisip, hindi mo yan maisasanla. Bakit? Overuse na. Mura na lang yan nabibili sa ukay-ukay na lang nabibenta ang overuse na utak. Ngayon, kung hindi mo gagamitin ang utak mo, ibenta mo na para umayos-ayos pa ang buhay mo. So, mag-isip. Mag-isip. Okay? So, tatandaan mo, ano ba ibig sabihin ng structure standard, process standard, at outcome. Okay? Have the key phrases. Hindi yung una nakita mo pa lang, isinagot mo na. Ano ba namang klaseng pag-iisip yan? Okay? Next. Care of clients, specifically establishing priorities. So, let's pay particular attention to this question. Okay? To this concept rather. So, SALT is actually a mass casualty triage system. Ano ibig sabihin ng SALT? Sort, assess, life-saving interventions, and then treatment and transport. Based on this principle, question, sino ang unang i-assess? Yung tao who cannot follow commands. Okay, now, yun ang unang i-assess. Pero sino ang unang priority? Yung pasyente na natag ng red. Okay, if the patient is tag red, ibig sabihin, red tag siya. Anong ibig sabihin nun? Listen. Immediate care ang kailangan. You have to act within 5 minutes or less. Sino yung mga yan? A person who is in shock with open fractures, who are prone to bleeding, and with second or third degree burns. Okay, now, if their nursing care can be delayed for 20 to 30 minutes or even a couple of hours, yellow yan. Yellow, ang ibig sabihin ng yellow, okay, ay their interventions can be delayed. So, they could be having serious injuries, but these injuries do not require immediate care. So, it's not immediately life-threatening. So, example niyan, ayan, nandyan yung yellow. Stable abdominal wound, the keyword is stable. Eye and CNS injuries. Okay, now, ngayon, yung green, minimal. Okay, the nursing care could be delayed for a couple of days. Minor, lahat ng minor. Okay? So pag sinabing lahat ng minor, green, okay, yan yung mga walking wounded. Nakakalakad pa. Kaya nga pag nag-sort ka, palakarin mo muna sila lahat. Lahat ng nakalakad pa, green yun. Walking wounded. Minor injuries, minor burns, ayan, minor fracture, minor bleeding. Lahat ng may word na minor, green yan. Lahat na nakakalakad, green yan. Ngayon, yung nakahiga, tapos sumusunghap-sunghap na, gray, bagong kulay yan, expected to die yon. Humihinga pa, pero sumusunghap-sunghap na lang. Pagkapatay na, unresponsive, o yung spinal cord injury was so high, like cervical 1 or cervical 2, in which the breathing could be affected, black yan, or dead. So, sino ang priority mo para i-transfer? Yung nakatag ng red. So, para hindi mo makalimutan to, remember, the priority, sino ang itatag ng red? Remember, RPM 32 can do. Ano ibig sabihin ng RPM? The 3 criteria. Okay? Respiration should be greater than 30. Okay? RP, pulse or capillary pressure should be greater than 2 seconds. Okay? And then, M, motor ability. Can do, ibig sabihin, can still follow commands. So, pag ang respiratory rate above 30, pag ang capillary refill time ay above 2 seconds, at they can follow commands, red kagad ang tag nun. All the rest, yellow na. Yung nakakalakad, green na yon. Okay? Ngayon, ang tanong, okay, so kapag ang pasyente mo ay merong abdominal wound, pero stable naman siya, that is considered yellow. Okay, here's the question now. A nurse is working in the ER when a 7.5 magnitude earthquake occurred. The hospital is having an increasing number of patients in the ER. A patient who suffered stable abdominal wounds without significant bleeding will be tagged. Alin ngayon ang isasagot natin dito? Ano ang sagot dito? O tignan mo. Kasi may nagmamarunong kaninang nagsasagot. Nagdi-discuss pa lang ako, nagbibigay na siya ng sagot. Mali naman yung sagot niya. O ngayon, na-realize mo. Okay? That is learning. Okay? So the answer is letter D. Okay? Excellent. Okay? Now, could you please type the total number of scores that you got out of this short mental drill that represents the framework? Okay? Before I give you the passing score. Okay? So, the passing score is 7 and the top-notcher's rating is at least 10. So if you got at least 10, you're off to becoming a top-notcher. If you got at least 7, that's a passing score. So once again, thank you very much. Add yourself to our back-to-back number 1 and almost 300 NLE top-notchers since 1994. I'd like to share with you an experience nung umattend nung last year dito sa Masterclass. Ito, sabi niya si Mary. Okay? Sabi niya, Sir Ray, pumasa po ako sa exam. Umiiyak pa rin po ako sa tuwa ngayon. Kung di po dahil sa gabay nyo at sa mga free YouTube videos ninyo, nakamit ko po ang pinapangarap kong lisensya. After 12 years and after 2 failed takes, natatawa ko na rin sa sarili ko na ganap na nurse na. Matatawag ko na rin sarili ko na ganap nurse na. Marami pong salamat sa inyo, naway bigyan kayo ng mahabang buhay at lakas para mas marami po kayong matulungan. To God be the glory, nagmamahal, Mary Rose RN. O yan, yung katatapos po ng day 1, lumabas po yung mga ni-rundown natin. Nursing Practice 2 and 3, pero most of it nasa Nursing Practice 3. Thank you po sa lahat, Sir Ray. And this is brought to you by Health Carousel Philippines. And I'm inviting you to actually watch our YouTube videos. Cluster ko yan. So, there are 5 clusters sa aking YouTube channel. Set A would be the videos for test 1, set B, the videos for test 2, set C, the videos for test 3, set D, the videos for test 4, and set E, the videos for test 5. Sana mapakinabangan nyo po ito. And if you need any help, last minute or otherwise, please feel free to send me a message, okay? Through my YouTube channel. So join us. Hindi na yun updated. We're now close to 20,000 subscribers in our class. So thank you very much. I'll entertain the questions after nung presentation ng ating mga experts. Maraming salamat po. Back to you, Miss April.
Wow. Thank you so much, Sir Ray. So, sino sa atin ang mga may natutunan ngayong umagang to? First part pa lang yan, pero sobrang very informative na guys, di ba? Yes, thank you, me, yan. So, sino ang magiging top notchers dito? Aba, bumagal yung chat. Sino magiging top notchers dito?
Ang daming may confidence.
Ako,
okay. Ayaw
yes,
nilang mapadala
me.
sa Quiapo.
Ayaw nilang wag.
Oo, palalagyan ko sila
Ayan.
ng mesa at saka payong doon, tsaka tarot card.
Naman. Pero, guys, thank you so much again, Sir Ray, for that very informative, no, and na presentation natin, na learning session natin about the NLE. So, guys, before we actually move dun sa ating next na mga presentations, meron tayong mga konting icebreaker. Okay? Para naman ito dun sa mga, I believe, mga early birds. Okay? So, meron tayong mga novelty items brought to you by Health Carousel Philippines. Ayan, hindi yata siya nakikita. So, meron tayong pillow neck, at neck pillow, neck pillow. Meron tayong duffel bag, and of course, a notebook. Yan. So, yun. I'd like to call on yung ating members ng Health Carousel Philippines to facilitate our icebreaker.
All right. Hi, everyone. Good morning. Good morning. Dami nating magiging top notchers, no? So, yes, hopefully, yun. Marami pa kayong learnings sa next session natin. But for now, mag-icebreaker muna tayo. I'm Andrea, by the way. I'm a recruiter from Health Carousel Philippines. And here with me is Chris. Hi, Chris.
Hi guys, good morning. So my name is Chris. So I'm also from our Cebu office. So sino yung mga Bisaya diyan? May buntag kaninyong tanan. So namahaw na bata? Okay, so I hope na marami tayong natutunan from Sir Ray. So now, para naman may konting fun tayo. So we are prepared a little icebreaker for you. Okay?
All right. So, yun, kami yung magiging game masters nyo today. Game masters talaga, no? So, we will be giving out prizes. But before we start the game, we would like to appreciate yung mga early bird participants natin. So, sila yung mga excited, no? At naghintay talaga na mag-start yung NLE Masterclass. So, we will have 3 winners for early bird. And then, one is Chris yung magsasabi ng top 3 na early birds natin today. So for the winners, please message yung mga yung panelists with your full name phone number, include nyo din yung email address nyo, and your complete mailing address. Kasi ipapadala namin yung prize today. Okay? So yan, napakita ni Miss April kanina, you will be winning novelty items from Health Carousel. So Chris, sino ba yung mga maswerteng nanalo for today?
For our first early bird, may I call Miss Jasmine Yaneza? So, are you here? Please, magparamdam ka sa chat box.
Gising pa ba?
Huh?
Si Jasmine.
Check natin sa chat box. Nandito ata si Miss Jasmine. So, siya yung number 1. And number 2 sa ating early bird, si Miss Jeline D. Espina. Okay, Miss Jeline, are you here?
Miss Jeline.
Yes, andito si Miss
Yun,
Jeline.
congratulations!
Ayun. Congratulations.
Novelty items from Health Carousel Philippines.
Nag-chat na ba si Miss Jasmine? Nagparamdam na ba siya?
Yes, oo,
Ayun,
nandyan.
Yes.
nakikita na. Okay. And number 3 sa ating early bird, si Miss Maria Mystica Vargas. Good morning po, Miss Maria.
Nandyan ka pa ba?
Bye-bye, hello. Ayun,
Yan.
kita ko na yung chat niya.
Yay! Congratulations!
Congratulations sa inyong tatlo.
So, ang
Alright.
mangyayari po ngayon dyan sa lahat ng mga early birds natin, no, our team will be messaging you personally or privately para makuha ang inyong full name, yung mobile number, and email address at the same time yung inyong resident or permanent residency, yung address po ninyo. Ipapadala namin yung novelty item.
Okay, so yun, please provide your complete mailing address sana. So for sure naman mahilig tayo mag-Shopee, mag-Lazada, mag-Shein, yung mga ginagamit natin na address. Yun yung ibigay niyo sa amin para mapadala namin yung prizes niyo. So now, let's have a game, no? So
Yes.
this will be our first game today. Later meron pa after the next session. So yung first game natin is called the emoji. All right, and our category is US states.
US states, oo.
Share my screen.
So, sino yung mga familiar dyan sa mga states sa US? O, yung mga may plano mag US, ito na yung ma-familiar din yung mga state. Okay, so, fun, mind-boggling game to.
You can see my screen naman, no? Okay. So, I have I have instructions lang before we start the game. So, yun, I'll be showing a set of emojis. All right. So, yun, I'll be showing a set of emojis and you need to guess ano yung US state. All right. So, rule number 1, you would need to wait for my code. So, before you type your guesses, para we would identify sino talaga yung winner. So, instead of saying 1, 2, 3, go, I will be saying a code. All right? So, yung magiging answer nyo would be code, yung ibibigay ko na code, space, then your answer or your guess. Okay? So, clear naman? Right? So, I think we need to have a trial muna, no? Try natin.
Yes, trial. Kasali ako, mag-guess din ako.
Huwag na. Participants lang.
Sige,
Okay.
sige.
So, trial muna. So, again, you need to wait for my 1, 2, 3 and the code before you type your answers. Okay? Sige. So, yan. Eto. Trial muna. Alright. Very easy lang yan. So, 1, 2, 3. Code is red.
Yun. Oo.
Oh, for sure, alam nyo na yan. Yes, the correct answer is Ohio.
Ohio.
Okay. So yan, very easy lang yung game natin today. So let's proceed sa game. And again, you'll be winning the same prizes. Yan sa early bird.
Don't
Okay,
forget na i-type mo na yung code before the answer.
That's right. So we'll have 3 winners for this game. So next. Okay, 1, 2, 3, violet. Very easy. Hawaii, sorry. No, it's not the correct answer.
No. Ayun,
Florida.
may nakita na ako.
Meron. Yes. Right. Or winner. Yes, may nakita kaming winner.
Clarice yung una. Miss Clarice?
Clarice. Okay. What's the full name of Clarice? Yon, Clarice Tan.
Tansi. Yes.
So the correct answer is Rhode
Rhode
Island.
Island.
Because of the island, siguro na kaya naka-answer ng Hawaii. So it's Rhode Island.
Itong first emoji nag-row kasi siya. Row your boat. So plus
That
D.
Okay. So yan, congratulations, Clarice. Please message our panelists for your prize, yung details mo so that we can send your prize. So next. Okay, very easy then. So in 3, 2, 1, Indigo. Very
Ayun, meron na. Ang bilis.
So tama naman lahat. The correct answer is Colorado.
Colorado.
So sino ba yung winner natin?
Yung una si AJ Kate.
What's the full name?
AJ Kate Mans. Wala, may ano yung full name?
AJ?
AJ Kate.
All right. So AJ, congratulations. Please message our panelists. All right. So one last. Very easy. So in 3, 2, 1, black. Walang code. Walang code is
Ayun,
considered
may
wrong.
black.
Wrong spelling, wrong din. So may nakatama naman. So our correct answer is
Maryland. Una
wrong
si
spelling wrong. Ano ba spelling ng Maryland?
si
So,
Alana Rayos.
Natin is okay. Very easy lang, no, yung game natin. Alam nyo lahat. Sino ba yung let us identify muna. Sino yung naka-answer ng correct answer?
Si Miss Alana Rose. Gap, Maryland. Correct spelling naman. Malaki lang yung A.
All right. So it's Alana?
Yes.
Yes. Okay. So Alana, please message your panelists. So that's it for our game today.
Congratulations sa mga winner.
Congratulations, everyone. Don't worry, meron pa tayong second game later.
Marami pa.
Thank you.
Thank you.
Thank you so much, Miss Andrea and Sir Chris, for facilitating our very, very fun game. So again, our team will be contacting you directly or will be reaching out to you para sa instructions kung paano natin marireceive yung ating mga novelty item. Okay, so but before we actually proceed again to the next part or the second part of the NLE Masterclass or the Nursing Forum, please be reminded, marami kasing nagtatanong, meron po tayong ipoprovide na certificate of participation as well dun sa mga makaka-complete ng ating webinar. Okay, so please stay until the end of our webinar. Ayan, para maka-receive tayo ng ating mga certificate. Okay, so ready na ba tayo? I hope nag-enjoy lahat sa icebreaker natin. Yes, thank you so much, Pearl, Jelly. Ayan, so while we are preparing for the presentation, yan. Shout out again to all of our participants. Yan, Jonathan, Glory, Eileen, yan. JV. Sa lahat ng attendees natin from all over the Philippines. Yan. Thank you all for attending. Okay. Are we all ready? From Holosulu, magandang umaga. Pagadian, yes, Cagayan Valley. from Laguna. Oh, shout out mga taga La Union. Ayan, Palawan, Surigao, Cavite, Aklan, Isabela, Naimbaga Bigat, kada kayo amin. Mga fellow Ilocano and Ilocana from Angeles, Pampanga, Nueva Ecija. Ayan, sa mga yung mga Bisaya natin diyan na kasama ngayong araw na 'to. Oh, Ilocos, Santiago. Ayan. So, guys, thank you all for attending again. Ayan. At habang kayo'y nagchat-chat dyan, let me introduce our next panelists or next mga speakers natin. So, let me introduce to you Dr. Glenda Arquiza. She is the chair of the Professional Regulatory Board of Nursing from August 23, 2017 to November 5, 2020. She is an experienced nursing faculty member and administrator. She was elected chair of the LCM 2018 Committee on Leadership and Management Change at Sukhothai Matitat Open University in Thailand. In 2019, she was the presiding officer of the 29th Association of Southeast Asian Nations Joint Coordinating Committee in Nursing meeting held in Manila. So she received the 2018 Gintong Mina Award in the field of education given on the occasion of the centennial year of the municipality of Teresa Rizal, a recipient of the 2010 Outstanding Philippine Women's University Alumni Award in the field of service and education, and the Outstanding Doctoral Dissertation for the school year 1997 to 1998 from the University of the Philippines College of Education and the Department of Science and Technology Science Education Institute. She presents and consults extensively on nursing curriculum, revisions, continuing professional development, and outcome-based education or OBE. Yan. And let us all welcome, guys, Dr. Glenda S. Arquiza in the panel. Good morning po, Dr. Glenda. While we are waiting for Dr. Glenda, I would like to introduce our another panelist who will be joining us. Next slide, please. Dr. Lucia V. Simon. So she was a head nurse at San Juan de Dios Hospital, ICU charge nurse at Passaic General Hospital School of Nursing at Passaic, New Jersey, USA, recipient of Scholarship in Medical and Surgical Education, NCLEX Certified, New Jersey, USA, Director of Nursing and Paratechnical Education at King Fahd Hospital, Al Bahas, Saudi Arabia, Nurse Reviewer for the State Board Examination from 1977, an educator, teaching medical, surgical, and maternal child nursing at San Juan de Dios College, full-time lecturer and clinical instructor for 13 years, also part-time lecturer in advanced maternal child nursing and nursing management to BSN student supplement course for 8 years at Manila Central University, member of the PRC Board of Nursing from February 12, 1995 to December 2002, accomplishment as accomplished Board of Nursing Professional Regulation Commission, co-author of Justice Jose Bellosilio, Attorney Midas P. Marquez, and Attorney Emmanuel Mapili. Title of the book is Introduction to Nursing Jurisprudence, Ethics, Leadership, and Management. So, ladies and gentlemen, let us all welcome Dr. Lucia Simon. Yan. And to complete our panelist or guest panelist, Dr. Gloria S. Arcos, former member of the PRC Board of Nursing, multi-awarded professional nurse, recipient of the Anastasia Giron Tupas Award, the highest award for nurses, finished her BSN degree from the University of Santo Tomas, Outstanding Distinguished Award for Nursing 2019 UST College of Nursing, Distinguished Award for the College of Nursing Representative to the Visiting Forces Agreement Council, Department of Foreign Affairs, Anastasia Giron Tupas Award, mentioned earlier, and Annie Sand Award, President Gloria Macapagal Arroyo and Secretary Manuel Dairit. Let us all welcome, ladies and gentlemen, Dr. Gloria S. Arco. Good morning po. Good morning po sa atin lahat, Dr. Glenda, Dr. Lucy, and Dr. Gloria. Good morning po.
Good morning.
Good
Can
morning,
you hear
ma'am.
me?
Yes. Okay. So, while we are waiting for Dr. Gloria and Dr. Lucy to join us as well, can we move on to the next slide, please? Okay, everyone. By the way, before I will be joining as well this forum, no, yung mga Q&A natin during this second part of our activity or of our webinar. By the way, my name is April. I am one of the supervisors here at Health Carousel Philippines. So, and I would like again everyone um, to be participative, no? Yung may mga questions kayo, may mga clarifications later on, Sir Ray or Dr. Ray will be joining us as well sa ating Q&A. Ayan. So these are the topics, no, that we will be discussing this afternoon. The issues and concerns that will be presented are clustered into five. So that's namely the NLE test framework, the NLE subjects, test requirements and procedures, the post-NLE procedures, passing mark and retake policies, and career pathway and professional organizations. Okay. May I know po if ready na si um, Dr. Gloria and Dr. Lucy? Yan. Good morning po, Dr. Gloria.
Good morning. Good morning. Can you hear
Good
me?
morning po.
Morning.
Yes, ma'am, we can hear you po.
All right. Thank you.
Okay, so for our first topic, Dr. Glenda and Dr. Gloria, the new NLE test framework. So, anyone po here can answer. In what way is the new test framework different from the previous one?
May I?
Yes, ma'am. Go ahead po.
Okay. I don't know if your schools have oriented you to the test framework. The test framework is supposed to be obedized or based on outcomes-based education, which is the CMO number 14 series of 2017. No? So, supposed to be the framework are the 14 learning outcomes of the BSN curriculum. Okay? But I heard Chairman T that while it is obidized, no, uh, don't worry, it will be the same competency-based curriculum. I would like to emphasize that OBE or outcomes-based curriculum based on CMO number 46, series of 2012, on outcomes-based education, it is explicitly written in the CMO that outcomes-based education is a competency-based curriculum. So whatever the framework is, whether it's a new or old framework, uh, the examine examinees are tested for your competency, what you have learned from your BSN program, no? The outcomes of the BSN program. The OBE curriculum is now using the learning outcomes, no? But actually, the learning outcomes are the terminal competencies of a program. In the past, we have the 11 key areas of responsibility, no? Okay? But now you are supposed to be tested on the 14 learning outcomes, but as Chairman LCT has said, uh, this will be uh, still, it will be competency based. Hmm? But yon, I want to emphasize ang OBE is a competency-based curriculum. So whether it is old or new framework, you will be tested on your competencies. And your competencies, of course, will be based on the standards, no? The PPNPS or the Philippine Professional Nursing Practice Standards. Okay? So maybe Dr. Arcos can add to what I have said.
Thank you. Thank you very much, Dr. Arkisa. Um, I just would like to add that this was already explained previously by Mentor Ray. He presented, the framework, and he also made mention that the test questions will be categorized into easy, moderate, and difficult. And that it was also taken from not only from the PPNPS but also from the PQF, where um, it is measured according to the categories or domains or like KSA or KSV, knowledge, skills, and values, also application, and the last one is the
Degree of independence.
independence. Yeah. So most of the questions, however, are threaded through. Right. This is the only thing that I would like to add. Whether Dr. Artisa mentioned whether it is the previous one or the new one or the OBE framework, the measurement will be on the competency of the taker, of the would-be registered nurse. So the mentor Ray also made mention of the different categories within the framework. Okay, ma'am. That's all but I.
Okay. So there will be Dr. Arcos mentioned about the PQF, no? There are three domains as he has mentioned. The first is the knowledge, skills, and values, no? Which will be 30% of the test. And then you have the application, which is 50%. Think Dr. Ray has explained this very well. No, and then the last one is 20%, which is supposed to be the degree of independence, which is difficult. No, so the degree of independence refers to responsibility and accountability. And when you talk about responsibility, it means the roles and functions of the nurse. And Dr. Ray has mentioned the roles and functions of the nurse in three areas: in client care, in research, and in leadership and management. The responsibilities, I mean, the roles and functions of the nurse is either dependent, independent, or interdependent. And the other aspect of degree of independence is the accountability. So your accountability will be based on the standards, no? As I've said, we have the PPNPS, or the Standards of Nursing Practice. We have also a standard of care, which is specific to a situation. For example, what is the standard of care for a patient in an immediate postpartum stage, no, or a care of the patient, standard uh, of care of a patient with tracheostomy. Okay, so that will be 20 items, then 50 items, and then ano, 30 items, and then 50, and then 20. No, for each nursing practice. As you know, there are five nursing practice. Practice 1, practice 2, 3, 4, and 5. And Dr. Ray has very well discussed this a while ago. Okay?
Thank you so much, Dr. Glenda and Dr. Gloria, for that. Next question: when will the new NLE framework be used?
Maybe Dr. Artisa can answer that because she attended the ADPCN convention. Ma'am Glenda?
No, I did not. I did not attend the ADPCN, but I attended the PNA convention, wherein the chairman of the present board of nursing is there, and there was a question whether the framework will be I mean the test will be obedized, and the answer given by Chairman T was yes, it will be obedized, but don't worry because uh, it will be competency based pa rin, no? So as I've said, uh, you are being tested on your competencies. So whether it is learning outcomes, I mean, whether the framework is uh, the new curriculum, no, on 14 learning outcomes, or the 11 key areas of responsibility. The 11 key areas of responsibility were harmonized into the PPNPS, no? So all these are part of the NLE framework. The PQF, as mentioned by Dr. Arcos, the 14 uh, learning outcomes of the CMO number 14 series of 2017, and then the PPNPS. Uh, I hope you are all familiar with the PPNPS. There are 4 domains. Okay. So these are also included in the framework. In the upper horizontal axis will be the uh, PQF, no? The KSB application and then degree of independence. And in the lower horizontal will be the PPNPS. In the vertical will be in the uh, vertical will be the learning outcomes. So I think there is a diagram for this. Dr. Ray, do you have
Ah,
the diagram for this?
ma'am, we don't have the diagram po.
Oh,
We
you
just
don't have the
focus on, yes,
diagram.
ma'am. May
I
question lang
see.
po that was sent a while back. Ang tanong is, how should the schools could have oriented the students in terms of the framework, ma'am? Kasi yung iba yata, hindi po, wala po silang idea na may ganito.
Uh,
Um, that question,
yes, Dr. Arcos.
actually, when we were sitting at board, we were always, informing the ADPCN through the board, and that we were asking them to to inform all the deans of all schools about the framework, about the contents of the NLE. We were emphasizing the PPNPS and the PQF, and in
Yes,
fact, also presented the PPD, right, ma'am? We
yeah,
presented all of this. We presented the resolutions that we had.
career
Um,
progression.
yes, and I think it is now in the hands of the deans to to orient their students, to
Yeah,
orient them about the NLP. It's no longer in our hands. When we invite the ADPCN, we believe that they will, give this all the information about the NLE. We have been answering their questions. We have attended the ADPCN forum and the convention,
yes,
and all the deans were there, and they were asking us questions. We were answering them to the best of our abilities. And I hope, Dr. Ray, that it's not good to hear that some of the schools or many of our students do not know about the NLE, do not know about the framework, do not know about the PQS and the OBE and so on and so forth. It's very sad. Thank you.
yeah. It's supposed to be from the time that you enter the nursing school, when you were in the first year. Uh, all these 14 learning outcomes should have been taken into consideration, no? Uh, like you have these learning outcomes. If you are familiar with the learning outcomes, there are performance indicators in each learning outcomes. There are all in all 57 indicators, no? Like for example, in learning outcome number 1, apply knowledge of physical, social, natural, and health sciences and humanities in the practice of nursing. The indicators for this will be integrate relevant principles of social, physical, natural, and health sciences and humanities in a given health and nursing situation. And then apply appropriate nursing concepts and actions holistically and comprehensively. So for learning outcome number one, there must be only uh, how many ang 2 over 57? 2 over 57 is how many? I don't have calculator because I'm using my so less than ano. As we have said, yung first PQF, no, yung KSB, there will be 30%, no? So there will be 30 items, no? 30 items in which this will be easy, no?
Yeah.
So, uh, I remember when we were deciding on the percentage, we started with 20, 50, and 30. And Dr. Arcos was the one who really recommended that the first KSB should be 30 so that uh, many students will have a chance of passing, no? Okay? Kasi these are supposed to be recall uh,
Question.
basic, no? Basic knowledge. And I think Dr. Ray has explained this very well. No? Uh, so dito sa iyong 30 items in the first PQF, the KSB will be distributed among the 14 learning outcomes, no? So actually, it is, as I've said, in uh, in outcome number one, you compute it as 2 over 57 times 100. So that will be the
3.
number of
Actually, 3, ma'am.
items.
Lumalabas po 3. 3
Three?
items, ma'am.
So,
Yes po.
3 items. So,
Okay.
yung 3 items under number 1, i-distribute mo naman yun doon sa horizontal X ba yun? X-axis. Sa horizontal, doon sa 3 domains ng PQF. Yung 3 items na yon sa learning outcomes 1. Or let's say, learning outcomes, learning outcome number 7. Work effectively in collaboration with inter, intra, and multidisciplinary and multicultural teams. Under this, you have 1, 2, 3, 4, 5, 6, 7, 8, 8 indicators. So 8 over 57 is how many?
Actually, before we left, we already computed
Yeah,
those, right,
we
ma'am?
already computed that.
14 items, ma'am. 14
14.
Yeah.
po. Opo, 14 items.
So, yung 14 na yon, you will distribute it doon sa 7 indicators and then across. Across
Opo.
doon sa 3. No?
Parang mas
Kaya
naging mahirap aralin yata ngayon, ma'am, kesa nung time ni Ma'am Lucy.
yeah, pero like,
Produkto po nung
yes,
time nila
it's
Ma'am Lucy.
very tedious. It's very tedious. O noon kasing time ni na Tita Lucy, ano ang framework is nursing process lang, if I remember right. 'Di ba? Nursing process lang. Wala pa yung ah kasi yung 11 key areas of responsibility nag-start kina Dr. Llanes.
Yeah.
No? Pero I
Yes.
think nung time ni na Tita Lucy, ang test framework is nursing process. But I would like to emphasize that the nursing process is a framework also, because when we develop questions, no, we utilize the nursing process. So if you are uh, if you are trying to analyze the question, you ask yourself kung ano ba ito, assessment ba ito? Ang focus ba is assessment? So doon sa options, ano yung related to assessment, then that will be the answer. Okay?
Thank you po, Dr. Glenda. Dr. Ray, thank you din po for joining the panel. So, um, let's move to the next topic, the NLE subject, passing mark and retake policies. So, what's the next question? Next slide, please. So, what part of the test is most difficult and which one is the easiest?
Dr. Arcos, you want to answer that?
Well, I think we already mentioned that the first part, which is equivalent to 30%, is the easiest. And then the
Uh-huh.
second is application. It is moderate. You need to say you still have to analyze all, right? Whether it is easy, moderate, or difficult. Now, the last part, which students will really have to analyze very keenly, and also because it's something that you'll have to process. Uh, it's something about how to create. Yes, ma'am.
Yes.
Uh, it's really difficult. But if you analyze the question very well, the situation, and then the question, and then the different options, that you know which one is not really relevant to the
Uh-huh.
question, and that the question is like this, you have to find the keywords.
Keywords.
I think it would be difficult for you.
Yeah.
Um, um, one thing that we have, we have we have seen among the takers is that they usually answer two or more in the option. If they are not sure, they will mark A, and then, ay, hindi yata tama. And they will mark also letter C. That in itself is already wrong. You are making the question, you are making it difficult on you. And because you think it is difficult, and you think that marking two options will make it correct, hindi tama. Hindi talaga tama. So you really have to analyze very well. First, the situation. Ano ba ang sinasabi sa situation? And then from the situation, analyze also very, very well the question. Ano ba ang hinihingi sa question? Ano ba ang tinatanong tungkol
Yeah.
doon sa situation? Pagkatapos nun, then you go to the different options. Alisin muna yung irrelevant. Di ba?
Right.
sample ni Dr. Ray kanina. Sabi niya, bakit kailangan yung immunization? Di ba? So, irrelevant talaga yung option na yun. Hindi kailangan. So, kung tatlo na lang natitira, alin ba dyan ang pinaka-the best? So, huwag nang mag-select ng dalawa o tatlo. Yun ang reason kung bakit noon ang daming bumabagsak kasi ang daming nagse-select ng dalawang options. And Shin will not, will read it wrong as wrong, will mark it as wrong rather, will mark it as wrong. Kaya, hindi tama talaga. So, itong easy, moderate, and difficult, threaded through naman ito sa lahat ng subjects. Diba, ma'am?
Yeah.
Sometimes you get,
Yes.
kagaya ng maternal and child, sometimes you get a question na palagay mo, ay hindi ito dito kasi psych ito, postpartum blues ito, hindi dapat ito dito. But it's part of OB, right? Or a child with schizophrenia, baka makita mo yan sa maternal and child, no? Because tinitingnan pa rin yung age ng bata. Kasi maternal and child nga, child yun eh. Something about mental health also affect children. So it might be difficult. It might be a difficult question on the part of the one answering it. And maybe he or she would say, why is this here when it is supposed to be in NP5? But remember that children may also suffer from mental health, something like that. And sometimes the taker will regard it as difficult.
Ma'am Glo, may question po. Sa research po daw ba, madami po daw ba lalabas? I think, ma'am, they have a misconception na puro research from, kasi naka-thread through ito. Can you help clarify this for them? Kasi kanina pa po nila sinasabi na, ang sabi daw sa kanila, mag-aral lang ng research. Baka mamaya mga ending research na lang pinag-aralan.
Yeah, I always, may I?
Yes, ma'am.
I always hear that na ang dami-daming research, no? Maraming research, no? Because one of the key areas of responsibility is research. And there are 5 nursing practice. Test 1, 2, 3, 4, 5. And for every test, there are 5 items of research, communication, and then ethics, no? All those. So, because for how many percent? 40%. 40% of the test items are related to the 11 key areas of responsibility, no? Kaya yung research, there are 25 questions kaagad related to research. The same thing with communication, may 25 questions kaagad. And plus, sometimes for situations regarding disease conditions, sometimes we do it, we attack it from research point of view, no? That's why it's very important talaga na research, no? Kasi in conditions also, we are using evidence-based nursing interventions. Di ba? Ang evidence-based nursing interventions are the results of research. So I hope naintindihan na ninyo yon bakit parang maraming research, no? Okay? But
So,
the same way, marami ding communication.
so to recap po, Ma'am Glenda, no, just to help out the students, parang 25 na meron kaagad na research,
Yeah,
25 na meron din kaagad communication, at we say 25 na meron
communication.
din kaagad ethics. So pag
Yeah,
inaral nila yung tatlong yon, may 75 questions na silang may sense of direction sila. Okay.
yeah.
And it's threaded through, meaning from test 1, 2, 3, 4, and 5.
And
Okay.
Yes.
5.
Ngayon, ma'am, sa threaded ako produkto po kasi ako nung licensure exam na per subject pa, at ang exam nung araw ay 1 week apart.
Yeah.
Oo. Oo. Actually, can I say something? Kung
Yes po.
nandyan pa rin kami,
Ma'am.
Ma'am April,
Yes, ma'am.
kung yan in front of the commissioners, we were saying that students or the takers were actually complaining that they would answer questions of research, 25 questions uh, of legal and moral and ethical, 25 questions of communication, etc., or management, and ano. Kami noon, we were trying to come up with an idea sana to point to assign
Yeah.
research on a certain subject only. For example,
Yes.
saan ba pwede ang research na mailagay lang sa isang subject? And we were talking na siguro sa medical. Yun, di ba ma'am, medical.
Yeah.
MP4, sabi nga ni ma'am, sa MP5 siguro hindi na. Sabi ko naman, pero sa community, di ba? Sa MP1.
Yeah.
We were
Yes.
saying to lessen ba the burden of the students answering 25 questions about research. So we were talking about that. And in fact, one of the commissioners were saying, if you can do that, why not? They also would like to agree. But because we were presented that framework before we came, nandyan na yung framework na yan, hindi kami makaalis-alis doon sa framework. But if we were still there, yun na sana ang gagawin namin. And then,
Yeah.
also saying, saan ba pwede yung legal and moral? Sabi ko naman, pwede naman siguro yan sa MP2. MP2, di ba? Yung mga ganyan. We were thinking about that already, Doc Ray.
Yes.
So maybe Dr. Akisa can add some more to what I have said.
Yeah. Actually, we have done that. We have like we have divided the 11 key areas of responsibility into 5, di ba?
Yes.
So, yun, as what Dr. Arcos has said, probably dito ang research or how many items ang research dito sa test 1, how many items sa test 5, something like that, no? Okay? But like, because I think there would be some difficulty in probably in not really in the checking, no, but I cannot remember now why it did not push through. Maybe you can remember, Doc Glo.
Even during, yes, ma'am. Thank you, ma'am. Even during the time of Dr. Carmen Sita Abakin, we were already about that.
Yeah.
But it not materialized because of the difficulty or the changing of the items sa machine ba, ma'am?
Yes.
Sa computer, ganon, and
Yes.
the formatting, uh,
Yeah.
because,
Remember now.
oh, iba yun, ma'am, because we were
Yes.
assigned to do that, and then 5 items here, ilang items dyan.
Yes.
So they were saying it would be difficult because
Yeah.
they will be adjusting the machine, something like that. That's what I remember.
Yeah, that's right. The
Yeah,
format, and it will be like it will be a big work, no? Kasi
not on,
they have to change. They have to change the program.
yeah, not on us because we wanted it because we
Yeah.
listened to the woes of of our takers and the
Yeah.
school. But yun na nga, yun na ang reason doon. Pero
Thank
sa amin,
Yeah.
So, Ma'am Glo, yung inyo palang team noon sa Board of Nursing is the Board of Nursing with a heart.
yeah,
Yes.
always
With a very
our
big
heart,
heart.
always bring
Yes.
our heart
That's
of
right.
Dr.
But
Ray.
like with a heart, but not uh, not compromising the integrity of the examination,
Yeah.
no? Oo. So we still develop the test question in such a way that it is clear, understandable, not really that, easy, no? Hindi yung gagawin namin ang test na easy para ano, uh,
Para marami.
para maraming pumasa. Hindi ganon, no? Okay?
We really wanted to check the competency of the
Yeah.
student, of the takers. Kasi later on, when they pass the board, they are registered nurses na, and no amount of error should be done by them. Or sabi mo nga sa ethics, dapat tama palagi ang pipiliin, hindi yung mali.
Ito na po, ma'am, yung next question. What is the passing score in the NLE? Do I need to get 75 correct answers out of 100 to get a rating of 75 in a subject?
Well, yes, the passing grade is still 75. Oo, 75 talaga. Pero ngayon, na hindi pa nagiging law yung bill natin, yung nursing bill, ay meron pang conditional. Meaning to say, if you fail on a subject pero parang passing ka rin sa lahat, you got 75, ang kukunin mo na lang ay yung subject na conditional ka.
Conditional. Yung do I need to get correct answers out 75 correct answers out of 100 items to get a rating of 75? No, because the scores are transmuted. We get the mean, no? Hindi yung 70 points talaga na you have to get 75 out of the 100, no? Wala nang makakapasa siguro. Baka even yung mga taga-UP. Sorry. Diba? It's transmuted just like in any
Parang sa college din, di ba, ma'am? Ganyan. Oo.
Yeah.
diba?
Mga final exams po, nakatransmute. Okay.
Yes, naka-transmute.
Talagang ano, ma'am, yun. BON with the heart talaga.
Oo. So, pero Doc Ray, we are assisted by the computer experts dyan. May
Yes, by statistician.
presentation kami. But it is always shown to us Is this correct? Mahaba ang proseso po. It's not just easy as that. Minsan nga,
Ma'am, may follow-up na question. Sabi, Ma'am Glenda, paano po ang transmutation? Nakadepende po ba sa highest na score or may quota ng passing rate? O, ayan, ma'am.
Usually, it's really, just like, how do you call it in statistics? Yung ano, there is a term there. But anyway, usually we get the mean.
Yes, ma'am. May mean siya.
Diba? Mean muna ang kinukuha, not the highest score.
Oo. Sa amin, lahat, kami, and bank, pinapa-approve by
Oo.
Ma'am, ito
We
ang tanong. It put a smile on my face. What if I haven't gone to the board exam, will I be considered failed? Siguro ang gusto niyang sabihin, paano pag hindi siya nakadating? Considered failed na daw ba yun?
Hindi. hindi naman siya nag-take, no?
Oo, hindi daw. Okay.
Oo,
then,
even if halimbawa if she started on the first day tapos she was not able to finish it, no? Then she will not be considered failed.
okay.
Oo.
So, ito ma'am, ilang percentage po para mapanatag? Medyo hindi ko maintindihan yung tanong niya. Baka ang gusto niyang malaman, ilan ang tatargetin niyang row score para makampante siya na mukhang papasa siya, ganon. Kung doon sa based on your experience, ma'am.
I cannot say it kasi every test is different ang mean, no? You know, para makampante ka talaga, you target for 75.
75. O, yan. You heard it from the former chair. Kailangan 75.
Diba?
O, di ba, ma'am?
Oo.
Ayan. So, I think nasagot na natin yung B3, Ma'am
Yes.
April. Okay, let's move
Okay,
on.
next question po. Is fundamentals in nursing a separate subject in the actual test?
No. It is already threaded through MP1 to MP5.
Okay. So, expect funda, ma'am, from test 1 to test 5. Okay?
Yes. Oo.
Next.
So every siguro I think what you will do is like you study more on like what are the common procedures in community health, for example. No, of course, home visit is a very common procedure, diba? Or urine test.
I agree, Ma'am Glenda.
Diba?
Alam mo, ma'am,
Oo.
meron akong laging sinasabi sa students na anong procedures ang pag-aaralan? Yung procedures na kailangan mong i-explain na may role yung pasyente. You
Yes.
focus on that. Like, for example, self-breast exam. Di ba? I-demo mo yan, pero kailangan malaman ng pasyente kasi it's not every month na you have to teach them to do self-breast exam. So, pag-aralan mo yon. Tapos,
Yes.
yung urine exam, how do they gather their urine? Kasi ituturo mo yun.
Yes.
Kailangan alam ng pasyente. So, I think, yun ma'am yung kinukulang, no? Yung ating Gen Z learners. Walang nag-guide na, ang minsan memorize nila puro yung indication ng procedure. That's already very medical. Di ba, ma'am? Hindi naman yun ang ating focus. Ang ating focus ay what will we teach our patient so that they get the procedure properly.
Yes. And then the common procedures done in, for example, in GIT, no? Gastrointestinal disorders. Ano yung mga common procedures? Di ba? NGT.
Yes, ma'am. NGT. Oo. Yung mga
Doon sa
na colostomy care.
Yes.
Oo, ganyan.
Sa surgery, care of wound. Di ba? Oo.
Yung mga post-op complications.
Yung tracheostomy, how to clean.
Yes.
Gano'n. Diba?
Okay, so nasagot natin itong B6. Ang bilis, Ma'am April.
Sige po.
Ayun, Ma'am April. Yung next, hindi backward.
Yung last, backward pa po. Yan. So
Yan.
there are social media sites and posts claiming to be a source of questions in the NLE. What can you say about this? This question is for everyone in the panel.
Maybe I will ask Dr. Arcos to
Ano ma?
answer this because her alma mater is the one always complaining about
Ay, sasamahan ko
about
si Dr.
this.
Arcos, our alma mater. Oh, yan.
Yeah,
Dalawa na
your
tayo,
alma
ma'am.
mater.
Dalawa na tayo, ma'am.
Yeah.
Uh,
Maybe
actually,
Dr. Arcos can answer this because Dr. Arcos.
Dr. Ray, Dr. Ray, assist ka.
Eh, ma'am, kasi alam ko may mga kwento-kwento ang mga estudyante. But you know how it goes? Maraming fake news kasi sa social media. Eh, nasa atin naman to exercise critical media literacy. As mature educators, we should not be supportive of this. Dapat right from the root cause, di ba, ma'am? Inip in the bud na nila at their level. Hindi yung sila pa
Yeah.
yung nagdadagdag ng issue. That should not be. Kasi kung makita mo naman na pinagtagpi-tagpi lang yung picture, nilagay kunwari yung picture ng BONA, dinagay kunwari yung screenshot ng previous question na nabibili sa Shopee. Di ba? Eh dapat hindi na yun hindi na yun pinaniniwalaan at pinipick up. Because on our level alone, we exercise critical media literacy. We should know better and we should teach our students to exercise the same.
That's right.
Yun po yung point ko, ma'am.
Yan. Kasi may pinapost niya sila na for me, it
Ma'am,
was...
clickbait ang tawag doon. Parang marketing lang nila, clickbait, para i-click mo yung site nila. Pero actually, wala naman.
Oo, naglagay ng picture, tapos naglagay ng questions, pero after the exams na, hindi during the exam. Sabi kasi, during the exams, may ganun. How come? Sabi ko,
Yeah.
Eh, ma'am, ano yon? Baka delusions. Kailangan na ng Thorazine.
and then, binight naman ng mga eskwelahan, tapos, pabalik na naman tayo sa 2006, something like that. Nakaka-turn.
Confuse,
na
ma'am,
tayo,
yung
diba?
mga NLE takers natin. So, ganyan.
Request na si Ma'am Lucy naka-mute daw po yata. Ma'am, gusto nilang marinig ang
Opo.
maganda mong boses.
Actually, tama ka, Dr. Ray, na
Okay, I'm sorry.
si tayo. Anyway, nandiyan si Ma'am Lucy.
Si Ma'am Lucy, nandyan na. The ever beautiful.
So I would just like to add, which was mentioned earlier, tungkol doon sa mga answering ng mga students sa test.
Yes po, ma'am.
It was mentioned that some had made some erasures, some give two answers. Right? Yes.
Right.
Even though there is an erasure or slight answer that you're going to erase, once the test question is placed on the OMR, this will
Yeah.
become red. Mamumula yun. Ibig sabihin, maski isang answer mo doon is correct, mayroon kang binura, that will still be picked up by the machine. So it would appear that you have two answers. And then that will invalidate your answers.
Answer.
Mali.
So, Ma'am Lucy, ang advice mo, wag mag-i-erase. Tama po ba?
No erasure. No erasure. That's why I was just wondering, how come they are advised to have with them an erasure and an eraser? What are they going to do that?
Yes, ma'am. Totoo ka po. Totoo ka, Ma'am
Yung
Lucy.
nakita ko yung bakit may eraser, magbubura ba sila?
Eh, ma'am, ito. Opo.
You know
May question.
Ma'am, ito ma'am ang question. Paano daw po pagpasmado ang
Pagpasmado.
kamay?
You know, even though yung nail, you
Opo.
try to do that on, sabi natin, ay markahan natin ng ito, balikan natin. magmamarka yan doon sa answer sheets. Pag linagay mo yan sa OMR, mamumula yun.
Tama po.
It was explained to us by the people doon sa loob. That's why we always tell our students not to do that. Ibang mga estudyante, they were insisting, ma'am, pwede daw mag-erase. Basta erasein mo mabuti.
Yun nga, ma'am. Pero actually, ma'am, the more na erasin mo yun ng mabigat, na para wala yung lead, the more that you damage the answer sheet, and then
Yes.
that is picked up by the machine. Totoo po
Yes,
yun,
that's
ma'am.
true.
Okay, let's move on to the next question, Ma'am April.
Yes
Test
po. So,
requirements.
test requirements and procedures. What is the proper attire po for the test? And can I wear a scrub suit? Do I need an RT-PCR test result to be able to take the test?
Grab suit, just come in uniform. That's all. There is a need for you to have a negative result ng COVID, against COVID. That is required now.
I would like to ask, excuse me, I would like to ask because of what I saw or what was told to me by some of these board takers is that they were asked not to place their nameplate. Basta daw nakaputi lang silang complete set ng uniform, no nameplate.
Wala naman talaga, ma'am, na nameplate.
Oo.
Wala talagang nameplate.
Oo.
Basta uniform, ma'am.
Complete
May
set.
the cap.
White.
Ma'am, ito yung sabi nila, no need na po for RT-PCR if fully vaccinated. So tinatanong po niya, kung hindi na siya mag-RT-PCR if fully vaccinated.
Saliva.
Did you get the latest bulletin from PRC regarding this?
Ito yung guidelines, ma'am, last year. Pero wala pa po yata silang usually, ma'am, a couple of days before they post it eh.
Wala pa kasing vaccine noon eh, di
Yes,
ba?
ma'am. Yes, ma'am.
Oo.
Pero ngayon yung
So,
vaccine card na lang po yata ang pinapadala.
siguro, and then probably I'm not updated kasi sa new guidelines as
Ma'am, it
to
will be on the website naman po siguro. Ng
oo,
PRC.
sa website siguro.
3 days before, ma'am.
Baka nga kailangan magdala sila ng mask. Diba?
Yes,
Pero
ma'am.
if they enter, probably they should not wear the mask para makita talaga ang mukha nila. The same sa naipasa nila picture. Pero inside the room, I think they should wear. No.
May
Pero
tanong po dito yung saan daw po makukuha yung stamp envelope? I think, ma'am, marami sa recto nun, di ba, ma'am? Sa harap ng PRC, doon may nagbibenta.
sa PRC lang yan.
Yes po.
Stamp envelope.
Yun. So, yes po.
Knowledge guidelines sa PRC.
Ma'am, meron na daw po, just the ID po na vaccine.
The
Okay.
vaccine.
Okay, that's good.
Okay po. Are we allowed to write on the questionnaire? If the questionnaire lacks a page, what should I do? If typographical errors occur, can questions be considered a bonus?
No.
And the direct answer is no. from Dr. Lucy. Ayan. So can we shade the answer sheet in a circular manner? What should I do if I inadvertently bore a hole on my answer sheet while shading?
That's overthinking.
I think so, ma'am. Pati itong isa sabi niya, what if left-handed po ang magte-take, tapos yung lead ng pencil dumikit sa kamay, tapos nadumihan, ma-invalid po ba ang papel? Once again, overthinking. May exercise all the necessary precautions. Siyempre, you won't allow that. Your professional life begins with taking care of your answer sheet. Oh.
Puro naman yung what if. That's overthinking. Be careful.
Yes po. Just making sure po, ma'am, ang nakalagay po kasi doon sa requirement ng PRC sa site nila, complete vaccination card / or negative RT-PCR or saliva or antigen test result. So, pag sinabing or, any one of those. Tama po ba, ma'am?
Everyone is those.
Oo,
Yes.
opo. So, hindi lahat yan. Baka lahat ipagawa nyo, sayang pera. Completely vaccinated na.
Yes. For this question, I think nasagot to ni Dr. Lucy
Yes.
kanina. Are we allowed to erase or
Reshade,
reshade?
hindi na.
Hindi. Can I take the test in the province even if I graduated from a school in Manila?
Yes, you can.
Yes.
Ma'am, may
Of
tanong dito. For retakers, okay lang po ba kahit naka-type C na dress? Hindi ko po alam kung ano yung type C.
Type C. Baka scrub. Hindi. White
Meron
lang.
type A, type B, type C.
Anything white except walang pants. Skirt,
Hindi.
skirt and
Oh.
blouse.
Okay.
Basta white. Pwede naman
No
pants.
t-shirt. No t-shirt.
Ang type C daw po ay black pants and shirt with collar.
Black
No.
pants. Walang black
No.
Hindi. Because they would not know naman sino yung retakers.
Mm-mm.
Okay.
So it should be talaga white uniform.
Tignan ninyo, ma'am, may label pa ang mga new generation na may type C pa silang nalalaman ng clothing na tayo hindi natin alam. So they always have to articulate. They should not assume that everybody knows everything in their minds. Okay.
Yeah.
Can I say something?
Yes po, ma'am.
Experience. Kasi may nalaman kami noon na may nag-take ng exam na hindi siya. So,
Oh.
we had to do something about it. Kasi nakaano siya, ano ba yung yung nagko-cover ng
More. Sa mask.
yung
Kaya
hindi, Muslim na
Basta-
naka
Pero covering the head.
oo, yung ano,
Face lang ang
abita ano yan ano yung ng Muslim
use that.
abaya
Yung hijab, ma'am, naka-hijab.
Nakahijad.
abaya abaya ba
Abaya.
yun?
Abaya.
Opo. Abaya.
Oo, yung abaya.
abaya
Hindi.
is a dress.
Mastura. Nikab. Meron po tayong mga suggestions.
Yeah, ang nag-take para sa kanya ay registered nurse na kasi.
Wow.
Pero nakaganon lang para hindi siya ma-identify na siya yun.
Yeah.
Ma'am, ito nakakatawa. Sabi po kasi, bag at wallet bawal. Paano po ang pamasahe?
Ibibigay yan doon sa supervisor, Doc Ray.
Ano daw ang pamasahe? I-Gcash mo na lang.
Well, excuse me, they are allowed to bring with them that transparent
Envelope, yes, ma'am.
envelope. They have to put their wallet inside that transparent envelope and then
Opo.
leave it in front doon sa watcher. May mga
Yes, ma'am.
place provided. They can do that.
Opo.
Able lang yung supervisor doon na extra. Doon nila ilalagay yan.
Oo.
Sige, what should I do po if I lose my notice of admission on the way to the testing center?
Overthinking na.
Overthink. Guys, huwag tayong mag-overthink, ha?
You know, that is the height of
Carelessness.
no, using the notice of admission.
You have to
Dapat prepared na all the things that we need to bring.
yeah.
They have
Yeah.
it
Yeah.
inside their what envelope.
Or you should prepare all the things that you will bring with you. Oh, diba?
Ma'am, ito, pwede daw po ba mag-CR during the exam?
Pwede
Yeah.
naman magpapaalam ka doon sa watcher
But-
and supervisor. I don't know. Ma'am Lucy, ano sa'yo?
Okay. They can be allowed to go to the CR, but one of the watcher should go with her in the bathroom. Doon na siya sa pinto. Then after using the bathroom, return na siya sa test room.
Tsaka alam ko yata ma'am, bawal sila makipag-usap on their
Yes.
way in and out
Yes.
of the restroom. Better
Yes.
yet, wag na lang kumain ng gas-forming food siguro para hindi mag-diarrhea on the day of
Si
the...
Ray, kung iihi na siya, paano yun? Iihi.
Tama ma'am.
Basta bawal magdala ng cellphone.
Yes.
Ah,
Ilagay na lang doon sa kanyang envelope.
Transparent envelope.
Oh,
Yes.
ma'am.
Ilagay lahat doon yung valuables nyo, guys.
Merong kababayan si Ma'am Glo sa Bicol. Worried lang po ako, sabi niya, sa susutin dahil babiyahe pa daw siya all the way to Sorsogon. Wala na po daw kasi siyang uniform.
Eh di ngayon, 10 days pa naman magpatahi.
Mm-mm.
Bili na lang. Cheaper. Bili na lang siya dyan ng ready-made o palda.
Oo, ma'am. Magpa-deliver siya sa Shopee.
Palda puti. Blouse na puti.
Oo. Hindi naman yung uniform mo nung estudyante ka Pwede naman puti. Basta puti.
Baka mamaya tumaba na siya.
Di nga.
Pag upo niya, ma'am, tatalsik na lahat ng butones nun. Pag tumaba siya at pinilit niya yung uniform niya. Sabi, sa Lazada daw at sa Shopee, 500 na lang daw po ang uniform. O, ayan. May naglagay na.
Okay, guys, if I pass the NLE but I'm not satisfied with my rating, will I be permitted to take it again?
No.
No.
No, no.
No more.
No more.
One take lang pag pumasa na tayo. If I inadvertently tear part of my answer sheet, will it be invalidated?
Again?
Yes.
If I inadvertently tear part of my answer sheet, will it be invalidated? May napunit po sa part ng answer sheet niya.
It will be invalidated. Who knows that is a sign? You are giving a sign. During our time, basta mayroong napunit or etc., that should be invalidated. I do not know at present.
Kaya nga, sabi natin, be careful.
Bakit naman mapunit, no?
Oh, sus naman.
I think hindi naman po yata sila strict sa shoes, ma'am, kasi may nagtanong, pwede daw po ba ang plastic white shoes ang gamitin?
Ay, bakit? Basta safe ka.
Yeah, basta safe ka daw, sabi ni former Bon Glo Arcos. Okay?
Pwede nga tennis shoes. Basta safe.
Pwede daw tennis shoes. Pati golf shoes naman, pwede na.
Hindi naman nakaputi ka.
Oo.
Can the quality of my shading on my answer sheet affect my scores?
Ayan si Ma'am Lucy, dyan? Kasi sa kanilang time nag-umpisa yung OMV.
Oo. As I mentioned earlier, na pag mag-shade ka ng test questions mo, maski even light or dark, basta within that area, okay lang yon. You don't need to fill up all those round areas. Basta may line lang yun ng ganun. Ma-pick up na yun ng OMR.
Thank you po, Dr. Lucy. Will I be allowed to use a calculator during the test?
No. No.
No.
Okay, guys. No, bawal. What are the common errors committed by NLE takers and what advice can you give to prevent such errors?
Errors? Yun, sinabi ko na, don't shade 2 options. 2 or 3. No? Don't make marks. Especially on the options or anywhere else sa paper mo.
May nagtatanong po, ma'am, allowed daw ba silang magdala ng pack lunch or allowed din daw silang bumili ng pagkain nila?
Well, they can bring their packed lunch, but they have to eat after the exam.
After the exam.
Yeah.
Thank you po. How many times can I take the NLE if the new nursing bill becomes a law before I become an RN?
If the new nursing bill becomes a law, you're only allowed 3 times. After that, no more.
Thank you
Be
po.
sure now to pass the NLE. No? Bago,
Ay,
bago.
ma'am, may
I
tanong.
think
Pwede daw po bang katabi ang mineral water habang nag-e-exam?
Pwede naman. Tubig yun.
Oo.
I think Miss Glenda has something to say.
Yes, going back to the error, one of the errors, there are two sets of tests, no? A and B, no? Be sure that if you, during the first day, set A ka, no? I mean, the first test, you were set A, be sure that the rest of the test, set A yung ano mo, yung test paper mo, no? Because there are different positioning, no? Different numbers, no, sa A and B. Okay? So dapat pag first exam you are set A, the rest of the exam should be set A din, no? Otherwise, yung scores mo will be affected.
Yan,
No?
thank you, Ma'am Glenda, for that great reminder. Oh, ma'am, ito, nakakangiti yung tanong niya. Is there an open store inside the testing area where we can buy food?
Wala.
I think, ma'am, di ba dapat binivisit nila yun before yung exam
Yeah.
to find out? Kasi iba-iba naman ang testing room.
Opo. Diba, hindi naman kami pumupunta sa testing areas, sir. We don't go to the testing areas. Ang PRC staff ang pumupunta. Kami hindi. So, we cannot answer.
Excuse me. Maybe what we can advise to the takers is that because they do not know where they can buy food. Baka mamaya malayo doon sa testing area nila. Advise them, I think, to bring with them sandwich. Ilagay lang doon sa transparent envelope.
Ito, ma'am, may follow-up po kay Ma'am Glenda. Regarding daw po sa set A and set B, pwede po ba magtanong sa proctor or ask an assistant to make sure po?
They do not know.
Ano naman? Anong to make sure? Tinatanong naman ng proctor na okay, set A dito, set B. Or set A ba kayo, set B. No? It
Sabi
should
niya,
look out talaga. It should look
tama,
out.
ma'am. I agree.
No? You
Sabi
cannot,
niya, ma'am, paano daw po pag magkamali yung proctor sa pagbigay ng set?
Can I add, Dr.
Yes, Ma'am Glo.
Ang set seating arrangement nila ay yung dati. So,
Opo.
yeah.
ang set A, doon pa rin sila uupo sa dati nilang upuan. Para alam na agad nung proctor na ay nasa set A sila. Pag nagkamali na dati silang set A, umupo sila sa ibang linya, baka mabigyan sila ng B.
Tama
Yeah.
po.
Ganon. So, saan sila nakaupo? At saka, tanong, bibigay ng test paper, ba? Sasabihin, set A po ako, sir. Ganun eh. Look out, sabi ni Ma'am Glenda, look out.
Ma'am, may tanong pa dito. Paano po pag sa choices ng answer, the same po yung dalawa? I think this has never happened naman in the board exam na may parehong sagot sa magkaibang option.
O kasi ini-edit naman before na
Wala
Print.
pa naman nangyari.
Pag nasa loob na kami, kasi actually we really do not know kung anong lalabas dyan.
O ito,
Then,
ma'am. May nakasulat po ba sa questionnaire na set A or set B? I think so, sa
Yes.
right upper hand side.
Yes, meron.
Yes, meron. Meron.
Thank you po. Let's move on to the next
Ay,
question.
may follow-up po.
Yes,
Ano
sir.
daw po ang pinagkaiba ng set A sa set B?
Yung arrangement.
Yung arrangement ng questions. The same questions but different numbers.
It's from
And
board.
the options, arrangement of the options.
Thank you po. So let's move on to the next part. Is the post NLE procedure. So is attendance to a formal oath-taking ceremony a requirement for the filing of license? Are there any alternatives for the formal oath-taking ceremony? And can nurses take their oath from a lawyer or authorized person?
It is important to take your oath of and it is equally important that you get your board rating and your yung certificate na binibigay because we are then asking to disseminate to all the schools that once the student pass the board exam and they should also complete, completely get their PICs and then the certificate. All taking, nag-oath ka, pirmahan yan later na administer ng oath, it will be brought that the paper na nakapirma ka o yung data mo tapos napirmahan na minister ng oath will be brought back to the and the date will be registered in the database of the PRC. Kasi kung hindi take oath, hindi ka sa paper, hindi ka ma-register as registered as professional. There's even a fixed RN under your name. So it's important to take of professional. Yes, pwede ka mag-oath sa lawyer, necessarily sa board nursing. Pwede naman sa lawyer ng PRC, di ba ma? Nakalagay naman yan sa guide. Additional, Ma'am Glenda.
Yeah, any government official can administer the oath. No? But I don't think a lawyer can. No? Yung mga notary public, no. Yung authorized person, yung mga like mayor for example or judge, no? Meron lang akong may nakita kasi akong question na kailan daw ipapatupad ang nursing bill, no? You do not tupad, hindi ka nagpapatupad ng nursing bill. Ang pinapatupad mo is the law, no? And the bill becomes a law when the president signed or approved it, no? Kasi ang president either vetoes or approve the bill, no? Okay? How does a bill become a law? It's a bill, no? It may either come from or start from House of the Representative or from the Senate of the Philippines, no? And then they will harmonize it, and as soon as they have harmonized it in Congress, then it goes to the office of the president for action. So the president may either approve it or veto it, no? Okay? So the president has to uh, act on it within 30 days from the time that it reaches his office, no? Otherwise, it will lapse into a law, just like the CPD. Huh? Okay? So, yung Congress is composed of the House of Representatives and the Senate of the Philippines, or the upper and the lower house. Do not say Congress if you mean yung House of the Representatives, no? Okay? Just for learning purposes, because this is a very common mistake. Okay? Yes, you
po.
can take your oath from any government official.
But normally, they ask permission from us, right? Diba? Humihingi pa sila ng permiso. Or
Uh, from the board or from PRC?
yeah, from the board, approved by the PRC, by the commission. Remember when some regional directors were asking if they can
Yeah,
they
yes. Oo.
administer the oath? They ask permission from us, approved by the commission.
I think if that is they ask permission if it is a mass or taking.
Okay.
But like I think any government official, you remember, even a barangay captain can administer the oath of office.
Yeah, but it is necessary to get the form para ma-firma.
Yeah.
And then the form should be submitted to the PRC para ma-register,
Yes.
because you will not be able to be registered if that form
Correct.
is not submitted to the
Yeah.
Ito po, is IV training a prerequisite to local employment of nurses?
I don't think that IB training is a prerequisite for local employment in the Philippines. It all depends on the hospital where you are applying for. If that particular hospital would require, they have to tell the applicants, okay, come back once you have the certificate of training, IB training.
Training.
So it
Ma'am.
all depends.
May I?
Yeah.
Yes.
Ma'am April,
Yes,
the board
ma'am.
of Training during our time has already submitted a resolution regarding IV therapy training. Hindi na yan, it is no longer a requirement for employment.
Yes.
Thank
And
you
it
po
is
for clarifying.
and it is not also a requirement for promotion.
Of course.
Yes.
Thank you po for the clarification, Dr. Gloria. So, is continuing education required for PRC ID renewal?
Yes, it is.
Next question, what
15
are some...
units.
Yes, ma'am, pwedeng utang po yata ngayon. May friends ako na nag-renew lately. Nag-accomplish lang po sila ng parang waiver.
I'm sorry.
Yeah, waiver. If you don't have any, if you don't have 15 units, you can you can submit a waiver, but the next time that you renew, you have to pay for it.
Yun po. Yes po.
So instead of 15 lang din, so you have to submit 30. Hmm?
May I, Doc Ray, Ma'am
Yes
April,
po, ma'am.
Yes po.
kasi ngayon, pandemya,
Opo.
he accepts, yung narrative
Yeah.
report ng nurse na nagbigay ng service sa community or sa hospital. All they have to do is write the narrative, ask the barangay captain and the public health nurse in the area to sign that narrative is really true and correct, or the chief nurse in the hospital, kahit job order, pwedeng firmahan yan ng chief. And then, that is already equivalent to a number of units.
Number of units, yes.
Thank you po. What are some regulations that will have an impact on our opportunities as nurses?
Di ba may ceiling yata ngayon ang deployment? I think si Dr. Lucy has a clear idea on yung deployment ceiling number, ma'am.
Well, the ceiling requirements for it all depends again in the country. Say, for example, if you are going to deploy nurses going to Kuwait, they will approve the first 25. So kung mayroon kang job order na 50, you bring it to POAA, they will not approve that 50. They will just approve 25. Once that 25 is already, those 25 applicants have gone already, then you refile the other 25.
O baka ma'am Lucy, pwedeng pag 50 ang job order, 100 ang i-file.
Ay, lalo hindi.
Para yung kalahati.
Sila. So, kaya nga sabi ko sa kanila, chop-chop nyo na lang. So, chop-chop mo na lang pagbigay mo ng job order. Wag mo lahat isabay. Well, really, our nurses, they are really want to leave the country. Once they have gained 2 years of experience, they wanted to leave the country. One of the predicament is that, how much do we receive here in the Philippines?
Yeah.
Agree, ma'am. Agree.
Yeah. But then, I always tell these nurses, kasi naghahanap sila ng mga Singapore, etc. But then I was telling them, Iha, so many hospitals in Singapore are looking for nurses. Be sure that what is written in the job order is staff nurses. Eh, ma'am, nakalagay doon, enrolled. If it is enrolled nurse, it is just an equivalent of a nursing aide. So that's why, even though you have 2 years of experience working in Singapore, and then you apply again, you come back here, you go to America, you go to Maldives, they will not consider that, because they will consider that there is a job gap working as a registered nurse.
Hello?
Yes, kaya nga dapat talaga tingnan nila
Maingat.
kung ano ang nakalagay. You know, it's not just getting people to be deployed. We have to be honest to the applicants, explain to them. Kasi sila ang kawawa.
Yeah.
Kawawa talaga.
Yeah. Ethical recruitment.
Yeah.
Thank you very much, Dr. Lucy, for that very insightful, no, regarding dito sa mga opportunities natin sa mga nurses natin. And then, for career pathway issues naman, do I still need, next question, I think, nasagot na yun kanina, is PNA membership required for employment?
No.
No.
It's institutional. For example, for schools, no? For schools being accredited by PAASCO, or even I think by PACOCOA, no? It is required that their faculty members should be should be a member of the APO, the Accredited Professional Organization. No? Okay.
May I add?
But then, excuse me, but then if they have to apply going abroad to other countries, PNA membership is not a requirement.
When may I add? During our time, there was a debate whether nursing organization should be APO or IPO integrated. If it is integrated, it is a must that a professional should be a member. Must. But if
Yes.
it's up, it is not required. Yun lang.
But
Eh,
Thank you po.
may I say something
Yes,
regarding
ma'am.
membership to PNA? I would encourage you to be members of the PNA, especially if you go abroad, no? Because actually, the PNA helps, no? Especially those who have had problems abroad. Yung PNA ang nag-help sa kanila. So I encourage that you
Grades.
you be a member of the PNA. No? There are
Agree.
some benefits.
yeah, I
Some
agree.
benefits of being a member.
Agree
Saka
ako.
ma'am, nag-i-increase ang membership fee.
Yes.
Nung unang panahon, kayang-kaya pa yan. Ngayon, medyo mahal na. So, it will increase further in the future. So, it's better to that's
I
one
think-
thing that they have to think about.
I think right now, if you have to apply for full-time membership, it's 1,500. Is that correct, Dr. Arcos?
That is for, ma'am. Is it for regular?
Regular,
Yes, ma'am. It is
1,500.
before our life membership fee. Ako, nagbayad lang ako noon, 300 pesos. Life member na ako.
Nung time namin, ma'am, 500.
Yes.
Life member.
When the president was still Lina, is that Lina Laiko? It was only 500.
500.
Lifetime members na yun.
Leda.
Leda,
Ma'am, ngayon, magkano ng lifetime membership? Mahal na.
1,500.
Hindi, ma'am. Regular ang
Regular yun.
Ay, pwede mo sabihin, mas mataas pa doon ngayon?
Ma'am,
Yes,
totoo ba
ma'am.
to? 5,000 PNA live membership?
Lifetime.
Yes, I think so. It's
Siguro.
5,000.
5,000 na yata.
Required to be a member, a regular member for 3 years.
Opo,
Right.
bago ka mag-lifetime.
Oo.
Yung regular membership nung time namin, ma'am, 40 pesos eh.
Correct ka dyan. Agree ako dyan. Tama ka dyan. Kasi Board of Governor ako niya noon.
Opo.
Yung 500 na yon, sinabi ko pa sa mga nurses dito sa Bicol, o sige, ako na babayad ng 500 nyo. Drop na lang kayo ng 100. Hindi ko alam.
Ma'am, ngayon mahal na. So, the more
5,000.
na pinuspone nila yung membership, the more that they will spend in the future.
Thank you po. So is it good po to take foreign certifications immediately after NLE?
Foreign certification.
What is that? Foreign certification? You mean exam?
Yes, ma'am. Yung
Yes
mga
po.
foreign exams.
Flex.
Yung mga NCLEX, ganyan.
I think because it is still fresh in their mind. They have to.
Yes. Especially po na if they really have plans to work abroad.
Yeah.
And they have to prepare kasi ma'am, yung next generation NCLEX naka-integrate ang English proficiency.
Yes.
Kasi may fill in the blanks na paragraphs na sila ngayon. So if they don't have a good grasp with grammar and good grasp of pathophysiology, medyo mas mahirap na po siya. And that's applicable na ng April 2023. So hindi na lang siya,
2023.
yes ma'am, hindi na siya uubra na hindi sila take ng certifications nila. Kasi yung NCSBN is recommending that within 2 years dapat ng graduation, sabi nga ni Dr. Lucy, para fresh pa, they have to finish all their certifications. Anyway, lifetime naman na yung results nun.
And I
But
think
ako, I would encourage you to serve your country first. By the way, yung those graduates ng state universities and colleges, they have a return service agreement. May RSA sila, no?
yes.
Yes, ma'am. At pag nag-take sila, ma'am, ng babayad sila
in the
ng tuition fee.
universal healthcare law.
Still, Ma'am Glenda, after passing the NLE, and if they wanted to take the foreign examinations for these nurses who are working with the state or were sponsored by the state university, I would still encourage them to go right away, take the foreign certification. Anyhow, they're gonna stay here in the Philippines, maybe to work for 1 year or 2 years. It all depends on the requirements of those agencies who sponsored them. Hindi wala na tayo ng oras. Andoon pa sa utak nila fresh.
Yeah.
Ma'am, may tanong dito. Very nice. Yung 2 days and 500 items po ba, mandated po ba siya ng government or may full control ang Board of Nursing? If ever, may chances po ba na mabago yon in the future?
100.
Kasi ma'am, sabi niya dito, PS, sometimes I tend to compare it with other exams outside the Philippines. Kasi ma'am, sa Middle East, meron talaga sila na 70 items lang. Meron din sila na 150 items lang. Yung NCLEX din po ngayon, ang maximum nila 145 na lang. Parang napag-iwanan tayo na 500 items pa rin po tayo.
Yeah. And to think that some countries do not give licensure exams.
Yeah.
Yes, ma'am. They have multi-level certification na pwede naman pong gawin sana.
Ako, I do not know. I do not know how to answer the question because I'm not in a position anymore. I hope they can.
Sabi nga ni Ma'am Glenda, we need one brave soul.
One brave soul, heart again.
Oo, with the heart again. Tama po, Ma'am Glo.
Thank you po for answering.
Dito daw muna sa bansa, baka sakaling tumaas daw ang sahod. Your thoughts, ma'am? May pag-asa ba? Anong salary grade na po ba dun sa bagong nursing bill ang mga nurses?
Ay, oo naman. And
Grade 15.
it's not only for public, but it's also for private. Private
Yes.
institutions. And I hope they will follow the law because even if there is the law, meron pa rin na mga lawless.
Yeah. I would like to ito sino yung president
Herrera?
hindi si President
Elvin?
Clinton, di ba? Sabi si President Clinton,
Yeah.
di ba? Sabi ni President Clinton, it's the economy, stupid.
Okay.
It's really the economy ng country, no? Diba? So unless our economy will improve, we will have nurses going abroad, no? Kasi the ratio of peso to dollar, no, it's always ano na ngayon? 60
1
na?
is to 59, ma'am, pero ang projection is it will go to 63.
Wow.
Ay,
No?
by
We
December?
cannot we
Yes,
cannot
ma'am.
blame our nurses also, no?
Kaya yung mga nurses na OFW ngayon, okay sa family nila yon.
Yes.
Because,
Yeah, okay sa
yeah,
family
opo.
nila.
That,
Pero
yeah.
pero
Ma'am Glenn,
sa
Tayong
atin
mga
ano,
nandito, ma'am, medyo,
oo,
tayo, we have to strategize.
yes.
May question,
Oo.
ma'am, dito pahabol. Paano daw po
Mm.
yung wala pang DR cases pero dineploy sa hospital na walang nanganganak?
ay naku po, wala siyang case.
Sabi ko, the school can strategize. Actually, di ba, ma'am? Alam ko meron ng circular na sinabi on the alternatives, ang CHED. So, yeah.
Yung ano, di ba, simulation. And
Simulation.
then,
Wala.
but they should have really one handle,
Mm-mm.
one actual handle.
Ayan na. Nasagot na nila, ma'am.
Ma'am
Na
Glenn,
actually may alternative ang CHED and you have to have at least one handle. Okay?
okay, Ma'am Glenn, do you
Yes.
think if we allow the students to take their delivery sa simulated lang,
Yeah.
will they be going to develop confidence in delivering in the future if they will be exposed in the delivery room? And no doctors that are present, no midwife that are present. Do you think they have this confidence to deliver the baby?
Ma'am
I
Lucy,
think
if I may.
it really depends on the
Mm-mm.
person. You
Mm-mm.
remember that that nurse who delivered a baby in the street?
Yes. Madalas ako
Diba?
magpapaanak dito sa
Oo,
street.
yeah. So it maybe they should make another study on how many really handle deliveries will make one confident, no? Kasi you remember during the time of Dr. Arugay, si Dr. Arugay made a study on the number of deliveries. That's why it became 3, no? Ang requirement naging 3. But like, diba, supposed to be, our curriculum is a competency-based curriculum. So, there are some students who will develop competency even with the first, diba?
Yes.
With the first try.
Thanks.
Mm-mm.
Ma'am, I think, ma'am, yung high fidelity mannequins na parang realistic talaga. Nakita ko
Yeah.
yung ginawa ni Ma'am Lucy dati sa CCP na skills laboratory niya na state of the art. I think, ma'am, kung doon naman magde-demo yung estudyante ng simulation, they will develop the confidence with you around. Ang ganda po nung kanyang laboratory doon.
Nagle-labor talaga si Mrs.
Oo.
Labor. Tapos later on, lalabas na yung baby.
Yeah.
Napakaganda. Ay, ma'am, may question po dito. Ano pang pwedeng gawin ng BON sa sitwasyon ngayon na may malaking kakulangan sa bilang ng mga nurses sa bansa?
Oh, I see. Okay. That is a good question. Ma'am Glenda, you first give your opinion, then I'll follow.
Sabi ng isa dito, ipasa daw lahat.
Ay,
No, it's really not only the responsibility of the Board of Nursing, no. Where does the training of the nurses start?
Yes.
No, it's in the school, diba? So we really have to improve our nursing schools. Okay. And then probably the curriculum should be relevant to the needs of the community, responsive to the needs of the community. it's really a very grave problem, no? So I do not know how we can solve it.
Ma'am Glenda, just to remind you a bit, kaya di ba ma'am, meron tayong ginagawang faculty workshop sa strategies, naalala mo, with Health Carousel sponsored din. In
Yeah.
a little way, at least makatulong tayong mag-retrain at sana i-retain ng mga universities yung mga faculty yung tinitrain natin.
Yeah. Oo.
Yun po. Yes, Ma'am Lucy.
Ma'am
Lucy,
Glenn,
Ma'am Lucy.
Ma'am Glenn, I would just like, I do not know if everybody is aware that there is still some moratorium in opening the School of Nursing.
No, it has been lifted.
Yes, I know it has been lifted, but here in Metro Manila, hindi pa na-lift. We are just waiting to be lifted.
Oh,
Yes, that is why I submitted another because CCT closed shop. There was about only 4 students, so we closed shop. And now there are so many people asking why don't they reopen. We just filed it three weeks ago. Yes, 3 weeks ago. But they told us, oh, wala pang moratorium ha, na malis dito sa Maynila, sa Metro Manila. In the provinces, listed na. Pero dito sa atin, wala pa. Bakit ganun?
Oo nga ma'am, bakit kaya ganun?
Dami-dami dito kulang.
Dito nga yung sentro ng kakulangan. Sa probinsya medyo
Yes.
sila doon.
Tita Lucy, when you close shop, what was the agreement? Will it be totally closed, or you have an option to reopen when yun nga, when the need arises?
Kasi ma'am, ito nangyari when I left, kasi nahiya lang ako, there were only 4 students. Okay, so I said, I will resign and then just retain 2 faculty. But then there is a need for signature for a dean. I'm very willing to sign that. So the chair asked, o 4 lang ito, wala pang ano. Then after 7 years, nagpadala sa kanilang notice that the school dapat ay ang president magpadala na ng kasulatan na it is for closure. Dapat hindi nila sinunod yun, di ba? Because pwede ka...
Yeah.
Yes. Yun ang recommendation ng CHED kasi it is the choice of the owner whether to close it or just to left it hanging. Ano ba yun? Close.
Yeah.
Kasi pag i-close mo na yun, start ka naman sa step number 1.
Step number 1.
That is what we did. Step number 1 talaga.
Yung kaurang ka.
So, hopefully by January sana malist na yun.
Sana nga ma'am.
Para makahabol kami sa August of 2023.
23. Ma'am, may tanong po dito. What are the plans of the BON with regard to batch 2022 student nurses who were experiments of online classes and that the majority lacks training and had less exposure on site due to the pandemic?
Ay, nako po.
That is, I think, the responsibility of the school.
The school,
It's not
I
the
agree.
responsibility of the Board of Nursing. The Board of Nursing is to regulate the practice of nursing in the Philippines. Yes.
Yung graduate na. Tama po.
Yes, yung graduate na.
Sir Ray, may I add?
Yes po, Dr. Simon.
Knowing that they lack experience, what I would recommend, go to a review center who could give them, who could augment their needs that they have not received during their school days. I think they will like this.
At saka ma'am, they could possibly have like 1 or 2 months volunteer sa kanilang district hospitals just to get the feel of it.
Yeah.
Oo. Kahit 1 or 2 months lang habang after ng board exam, nag-aantay ng result. So, para yung skills nila kahit papaano nandoon.
Pero I think
Mm-mm.
what ang concern nila is the preparation and taking the board exam because
Yes, ma'am.
their skills are lacking.
Opo.
Eh pag hindi pa sila nagpunta sa hospitals for
Mhm.
a training, doon na lang gawin ito muna. Gawa nila ng paraan ni Dr. Ray kung paano ma-augment yung kakulangan ng mga bata.
Yes, ma'am. Actually, ma'am, I have a website now, a YouTube channel doing that.
Yes.
Oo, para we give out clusters of videos para makapag-augment across anyone who will ask help from us. Ginawa na po naming advocacy yun, pati. Para kahit pa paano makatulong. Yes, Dr. Arcos po.
Kasi, di ba, may virtual RLE na ngayon. And
Mm-mm.
most of them are run by review centers. And I'm happy about it. I'm happy
Pero
about it.
ma'am, pag virtual pa rin yun, ma'am eh. I think
Virtual.
what they're looking is the actual.
Pero may virtual nga, pero nasa area naman, like OR, andoon naman sa OR yung camera. That's what I know. Kasi present sa akin yung programa, pero hindi na ako nag-active. Meron kasi clinical instruction.
Yes.
Kanila, ganyan. I don't know kung successful ito, I really do not know.
Dr. Arcos,
Maybe ma'am, pwedeng yun, topic ng research.
Silliman University has a very good simulation program, no? Because they train from Texas University, no? So parang naging gold standard in simulation yung Silliman, no? In fact, they are training, sila yung nag-train, they trained even na UST, sila ang nag-train sa simulation, no? Sa FEU, and almost all schools in Mindanao and in the Visayas. They have very good program on simulation. They have one whole building.
Ma'am, ang concern lang po sa simulation kasi, mahal po yung mag-maintain ng simulation laboratory.
That's
Because
right.
recalibrating the mannequin, especially pag high fidelity, would really
Yes.
cost so much. Like one mannequin could cost you 500,000 for recalibration alone para magamit na naman ng mga bata. So parang meron din siyang maximum usage ceiling. So yung mga maliliit na schools, hindi nila kaya yon. Kaya nga ang ina-advocate ko noon, isama sa affiliation tour ng mga provincial schools ang mag-tour sa mga schools katulad nung kay Ma'am Lucy, ang ganda-ganda ng laboratory niya. Pumunta sila para ma-experience ng mga bata. Hindi man nila makita sa school nila, pero makita nila sa iba na meron palang ganito. So they at least would be aware and familiar. When I was president ng PNA doon sa amin, I went out of my way talking to the different schools and arranging for that. But at the end of it, ang comment sa akin ng isang nasa akademya, bakit ko daw pinopromote yung ibang eskwelahan sa mga estudyante nila? So they're looking at it the other way. So nag-hands-off policy na lang ako. Because the idea should have been, hindi naman kakayanin ng eskwelahan nyo na magkaroon ng simulation. Ano man lang ba yung isang araw from your affiliation sa Manila, idagdag nyo, I'll arrange for a tour, you go to this school na may magandang simulation lab for you to get to see it, the students can feel it, and at least they know that there's such a thing. Ayun.
We did it at FEU. You remember that FEU used to be the gold standard in simulation. So there are some schools that do their tour, no, in our vines. We call it mutual integrated nursing education simulation lab.
Okay. Last two questions na daw po, ma'am, sabi ni Ma'am April.
Okay.
And meron pa ba tayong mga additional questions dito sa chat? And we can accommodate last two questions. Ito, from Maria Clariza, for the minor cases po sa OR, will it be okay na puro suturing yung 3 cases na meron?
Hindi pwede.
Hindi pwede. Dapat may variety of cases. Actually, noon, inalis na yung minor na yan eh. It was if the role of the nurse in the OR, if you're a circulator or a scrub nurse, yun na,
Scrub nurse.
hindi na yung minor and major kasi nahirapan nga kumuha ng mga minor surgeries. To the point na dinadaya na lang. Diba? So circumcision, pwede yun. Diba? And then, tubal ligation. Oh, dami namang minor dyan. Suturing. IND. Oh, yun ang mga ano. Pero hindi naman pwede lahat na lang suturing. Yeah.
Thank you po for answering that question. Ito po. Last from Rika, may need pa po ba na requirement yung RLE summary in taking the NLE exam?
Ang ano kasi, that is di ba, they cannot graduate without this. So that is the responsibility of the school. It's not anymore the responsibility of the Board of Nursing. No?
School and CHED, ma'am. School and CHED.
School and CHED, yes.
Tapos, kung may questions lang, ang school or students, papasa sa school, papasa sa CHED, or minsan, dinidirect din sa amin, tapos, magko-comment kami and bank, or the oversight of NLE. Diba, ma'am? May mga questions.
Diba, they cannot graduate, no? It's a requirement of graduation na yung
Cases.
yung mga scrubs.
Yeah.
That's why yung registrar and the dean, di ba, yun na lang ang ginagawa nila? They certify.
Yeah.
Yun na lang sinasubmit nila.
Thank you po. So lastly, any message po to close off itong forum po natin, any message po na gusto nyong sabihin to our future RNs? Yan. Ready na po silang maging RN this upcoming November NLE.
I hope by now you're prepared. No? You had 4 years before you. You have read your books. You have exposed yourselves in hospitals and community and so on for your clinical experience, which for me is a very important matter in taking the board exams because you cannot actually memorize all the books, all the things that are written in the book, but it's easier if you experience it. Sabi nga, learn it by the book, but you add more learning when you do it yourself, and it is more retained in your brain when you have done it. And I wish that the review that you're going to take or that you have had you enhanced all the learnings that you have had for the past 4 years. So I believe that all these preparations that you have had for the past several months, probably under a review center, will be highlighted by your ano to, by becoming confident in terms of you are prepared mentally, emotionally, physically, and spiritually. So in the end, I would say that above everything, above all else of your preparation, God will always be there for you. So pray very well, ask for the grace from God, ask for the blessing from God, and He will grant all this to you. God bless you, and we will pray that you will be successful in your NLE. And that once you become an RN, be a good person first before you become a good nurse. Thank you very much.
Very well said, Dr. Gloria. Thank you po.
Yes, I agree to what all Dr. Arcos has said. I say amen. Thank
Amen.
you. And good luck to all of you.
And for me too, I would agree to what to what Dr. Arcos had mentioned earlier, how to prepare yourself in taking the nurse licensure examination. Never forget that you have always Jesus in your heart. Because
Yes.
whatever, there is always a saying, knock and thou shalt be open. So
Yeah.
always ask for his help. I know he will always be there for you. Even though, even though we are sinners, he still loves us. Mahal na mahal tayo ng Diyos. He will be there to help us in time we need him. And then once you pass the board exam, you can start already trying to think, what would you wanted to become someday? Pero at least may aim na kayo. Okay? Maybe you would think, oh, I will join the hospital team. I would like to become a staff nurse. And then I would try to ambition to become a future director of nursing. What should you do so then you can attain this goal? Know what are the requirements? Okay, the academic preparation, and then your preparation in the clinical area. And then your PR, your disability, or the skill, SKA that you need. It will help you to prepare what you wanted to become someday. Kailangan nyo, mayroon tayong preparation. Know yourself. Sabi mo, ay, kayang-kaya ko maging director of nursing. Because it knows. Yes, ma'am. Kayang-kaya yan. Do you know that somebody have dreamed of that? And she was able to attain. She also dreamed to become a board of nursing. So she tried to find out what are the needs, what are the requirements, and she was able to attain it. All of those things that you wanted to attain, you must really strive, make a preparation, work hard for it. So then at the end of the day, you will keep smiling. Ma'am, kayang-kaya yun. Basta ilagay lang natin sa puso natin na kaya natin.
Yeah.
Because we should assess ourselves kung hanggang saan lang tayo. That's all what I can contribute.
Thank you so much, Dr. Simon. Na mga napaka-encouraging no, ng mga messages ng ating mga speakers. Dr. Ray.
What can I say but all of the above? I am below all of the queens in the profession. Ako po, nung ako estudyante at hanggang ngayon, tinitingala ko po sila and my respect goes to them, especially nagkaroon ako ng pagkakataon. Nakakatuwa nga lahat ng aking mga kasama sa forum ngayon ay mga honorable. Okay? Ako ay pang-horrorable.
Ano?
I'm so happy na nadagdagan yung kaalaman ng ating mga fellow learners ngayon, and they got it straight from the experts, those who crafted the framework and those who are in a position to give them sound advice in terms of career directions that they may want to take after passing the licensure exam. And for all of that, I thank everyone for coming up with this forum. We'll have more of this. At baka makalimutan lang, meron po kaming ginagawa ngayon na workshop sa teaching and learning strategies, innovative teaching learning strategies by Health Carousel pa rin po. Kasama pa rin po si Ma'am Glenda, and to jumpstart the training ay Baguio, I think yung unang gagawin yon. So that's limited for contribution na rin namin with Health Carousel sa ating mga nurse educators na ngayon kailangan sila. Let's not take them out of the country because otherwise the entire system may collapse if we'll have an absence of competent educators. And in front of you are the very, very competent, dedicated, and the educators with a heart. Of course, Drs. Lucy Simon, Dr. Glenda Arquiza, and Dr. Gloria Arcos. So maraming salamat po, ma'am, and I'm so happy I've been part of the forum.
Thank you so much. Thank you, Sir Ray.